Hi everyone, this is Dr. Ankit Goel, your mental health nursing faculty at NNL 1 and I welcome you all in this video. इस वीडियो में हम मेंटल हेल्थ नर्सिंग के कुछ इंपॉर्टेंट वन लाइनर्स डिस्कस करेंगे फ्रॉम योर फेवरेट बुक मास्टर स्ट्रोक। तो ये बात करते हैं, सबसे पहला टॉपिक इंट्रोडक्शन में हम दो इंपॉर्टेंट क्लासिफिकेशंस डिस्कस करेंगे जो हम साइकाइट्रिक डिसऑर्डर्स में यूज करते हैं। पहली क्लासिफिकेशन है आईसीडी। आईसीडी का मतलब क्या होता है? आईसीडी स्टैंड्स फॉर इंटरनेशनल क्लासिफिकेशन ऑफ डिजीजेस। आईसीडी ये एक डायग्नोस्टिक टूल है जो हम यूज करते हैं टू क्लासिफाई एंड मॉनिटर द कॉजेज ऑफ इंजरी एंड डेथ एंड ऑल्सो इट मेंटेन्स इंफॉर्मेशन फॉर हेल्थ एनालिसिस, जैसे कि स्टडी ऑफ मोर्टेलिटी एंड मॉर्बिडिटी ट्रेंड्स। आईसीडी का जो लेटेस्ट एडिशन अभी है वो है आईसीडी 11। रिमेंबर, आईसीडी सिर्फ साइकाइट्रिक डिसऑर्डर्स के लिए नहीं है, बाकी सारे डिसऑर्डर्स जैसे मेडिसिन, सर्जरी, ऑब्जन गायनी एटसेट्रा और सारे डिसऑर्डर्स भी इसमें आते हैं। आईसीडी को कौन पब्लिश करता है? रिमेंबर, आईसीडी इज गिवन बाय हु? इट इज गिवन बाय WHO यानी कि वर्ल्ड हेल्थ ऑर्गेनाइजेशन। एक और इंपॉर्टेंट क्लासिफिकेशन जो हम साइकाइट्रिक डिसऑर्डर्स के लिए यूज करते हैं वो है DSM। DSM स्टैंड्स फॉर डायग्नोस्टिक एंड स्टैटिस्टिकल मैनुअल। रिमेंबर, DSM होता है सिर्फ मेंटल डिसऑर्डर्स के लिए और DSM कौन पब्लिश करता है? इट इज पब्लिश्ड बाय APA यानी कि अमेरिकन साइकाइट्रिक एसोसिएशन। इट्स अ अमेरिकन क्लासिफिकेशन बट वर्ल्ड वाइड ये भी यूज होता है। तो हमारे पास दो इंपॉर्टेंट क्लासिफिकेशन है, वन इज आईसीडी एंड अनदर इज DSM एंड DSM में हमारे पास अभी एडिशन है DSM-5। तो ये दो इंपॉर्टेंट क्लासिफिकेशन है। नेक्स्ट लेट्स डिस्कस व्हाट इज इंडियन साइकाइट्रिक सोसाइटी। ये लार्जेस्ट एसोसिएशन है ऑफ इंडियन साइकाइट्रिस्ट और ये कब फाउंड हुआ था? रिमेंबर, इट वाज फाउंडेड, सो यू कैन रिमेंबर फ्रॉम इंडिपेंडेंस ईयर 1947 से याद रखना है। इट वाज फाउंडेड ऑन 7th of January 1947। नेशनल मेंटल हेल्थ प्रोग्राम was launched in which year? Remember, national mental health program launch हुआ था in the year 1982। Remember, ये national mental health program। एक और point you can remember that is national mental health policy। policy कब आया था? in 2014। so remember, program came in 1982 और जो national mental health policy है it came in 2014। मेंटल हेल्थ बिल ये एक्ट कब बना था? रिमेंबर, इट बिकेम मेंटल हेल्थ एक्ट इन 1987 एंड नाउ रिमेंबर, जो मेंटल हेल्थ एक्ट है उसको अब रिप्लेस कर दिया एक बहुत इंपॉर्टेंट एक्ट ने, दैट इज द मेंटल हेल्थ केयर एक्ट 2017। नाउ दिस इज अ वेरी इंपॉर्टेंट एक्ट रिलेटेड विद मेंटल इलनेस इन इंडिया, मेंटल हेल्थ केयर एक्ट 2017। अकॉर्डिंग टू मेंटल हेल्थ केयर एक्ट 2017, an experienced psychiatric nurse is posted in central or the state mental health authority as they are trained for specialized centers। एक और important date which we should remember वो है World Mental Health Day। कब हम celebrate करते हैं? Remember, every year we celebrate World Mental Health Day on 10th of October। So these are some important points you should remember। Now let's talk about some important theoricists and their contribution। कुछ important contribution हम डिस्कस करेंगे, सम इंपॉर्टेंट थ्योरीज विल डिस्कस और किसने ये थ्योरीज दी थी। द फर्स्ट इंपॉर्टेंट थ्योरी विच विल डिस्कस इज द साइकोसोशल डेवलपमेंट। जो स्टेजेस ऑफ साइकोसोशल डेवलपमेंट, दीज आर 8 स्टेजेस एंड दीज रन फ्रॉम द बर्थ टिल द डेथ। सो दीज आर 8 स्टेजेस एंड ये 8 स्टेजेस ऑफ साइकोसोशल डेवलपमेंट किसने दी थी? रिमेंबर, these stages were given by Erik Erikson। so very important, remember, these stages were given by Erik Erikson। Now, who coined the term schizophrenia? In fact, everything about schizophrenia is important। History से लेकर management तक everything is important। So, schizophrenia जो term है, schizophrenia एक psychotic illness है। ये किसने coin की थी? Remember, the term schizophrenia was coined by Eugene Bleuler। Bleuler का एक और important contribution में discuss करेंगे, that is, he gave 4 A's of schizophrenia। Now, who is considered as the founder of psychoanalysis? Psyche मतलब mind analysis, so analysis of the mind। In fact, he is also known as the father of psychoanalysis। Remember, it is Sigmund Freud। So Sigmund Freud is considered the father of psychoanalysis। Now let's discuss another theory, theory of cognitive development। Cognitive मतलब thinking। So thinking process कैसे develop होता है, इसकी 4 stages दी गई हैं in this cognitive developmental stages। and ये जो stages हैं ये किसने दिए? Remember, these are given by जीन पियाजे। तो जीन पियाजे ने थ्योरी ऑफ कॉग्निटिव डेवलपमेंट दिया है। Another important point in the history of schizophrenia, remember, first rank symptoms of schizophrenia जिन्हें हम SFRS भी कहते हैं। So SFRS, I'm giving you a hint, किसने दिए थे? So first rank symptoms of schizophrenia, these were given by Schneider. So remember, Kurt Schneider ने दिए थे first rank symptoms of schizophrenia, and these are 11 symptoms. Who coined the term psychiatry? Psyche मतलब mind, itry मतलब healing or cure. So psychiatry is a branch of medicine जो deal करता है problems of the mind and its treatment. So who coined the term psychiatry? Remember, the term psychiatry was coined by German physician with the name Johann Christian Reed. टर्म कैटाटोनिया किसने कॉइन किया था? रिमेंबर, सी से कैटाटोनिया, रिमेंबर के से कार्ल कैलबॉम। तो कैलबॉम ने कॉइन किया था टर्म कैटाटोनिया। कैटाटोनिया क्या होता है? दीज आर ग्रुप ऑफ मोटर साइंस एंड सिम्टम्स which can be seen in various conditions, जैसे schizophrenia, mood disorder and various other conditions it can be seen. Some catatonic signs and symptoms include जैसे कि stupor, excitement, mutism, there is waxy flexibility, echolalia, echopraxia, and so many other catatonic signs and symptoms are there. Who described the hierarchy of needs theory? Remember, hierarchy of needs theory was given by Maslow. That is, Abraham Maslow ने दिया था hierarchy of needs theory. So these are some important theoricists and their contribution. Now let's talk about some important theories given by Sigmund Freud. So Sigmund Freud he gave various theories of the mind. So he tried to understand mind and gave certain theories. So let's first discuss about the Freudian personality structure. Freud ने theory दिया था structural theory of mind or structural model of mind in which he divided mind into 3 parts. तो उन्होंने माइंड को 3 पार्ट्स में डिवाइड किया था। कौन कौन से पार्ट्स थे? इड, ईगो एंड सुपर ईगो। हाउ टू रिमेंबर? रिमेंबर, सुपर ईगो, एस फॉर सुपर ईगो आता है एस फॉर स्ट्रक्चरल मॉडल ऑफ माइंड। इसमें माइंड में जो उन्होंने 3 पार्ट्स में डिवाइड किया था, पहला है इड। इड का मतलब है इंस्टिंक्टिव ड्राइव। सो ये ऑपरेट करता है बेस्ड ऑन दी प्लेजर प्रिंसिपल। सो जस्ट लाइक एनिमल, दिस पार्ट ऑफ द माइंड इट रिक्वायर्स इमीडिएट क्लासिफिकेशन। सो इमीडिएटली उसको ग्रेटिफिकेशन चाहिए एंड इट इज द प्रिमिटिव unconscious part of the personality. Then there is super ego. Super ego is basically the moral compass. It basically wants to do socially acceptable behavior. So it works on moral ideals and conscious. So one is id, which is saying, I want immediate gratification. जबकि super ego है जो कह रहा है कि नहीं, we should do what the society says is right. So the mind gets stuck. And who balances the friction between id and super ego? Remember, it is the ego. Ego जो है वो operate करता है on the reality principle. It tries to mediate a balance between id and super ego. So let me give you an example. Suppose there is a student whose exams are approaching. His id is saying, "Arey, what are you doing? Let's go and have fun. Let's watch a movie." While super ego is saying, "No, exams are coming. We should study." So can you appreciate? एक imbalance हो गया, एक friction हो गई दोनों में. कौन आता है balance में? Ego comes to the rescue. So ego then tries to balance it out. So ego, lets the person to study for a few hours and then maybe we can go and watch the movie. So this is the structural model of mind given by Sigmund Freud. Sigmund Freud ने एक और important theory दिया था, model of mind दिया था, that is known as the topographical model of the mind or topographical theory of the mind, in which again he divided mind into 3 parts. That is the conscious, pre-conscious and unconscious. Pre-conscious is that part of the mind जिसके content से we are aware. So whatever is going in your mind right now, what you did yesterday, so all those things जिसके लिए हमारे पास awareness है, that is in the conscious part. Then pre-conscious part is that part जिसके content से right now we are not aware, but awareness can be brought by focused attention. For example, if I ask you what were you doing this very moment, this particular day, 1 year back, तो आप बोलोगे सर हाउ डू आई नो, मुझे याद नहीं है. बट मे बी इफ यू गो 1 day backwards, मे बी देयर इज अ टाइम व्हेन यू आर एबल टू रिमेंबर. सो दैट कंटेंट इज इन द प्री कॉन्शियस. अनकॉन्शियस माइंड इज दैट माइंड जिसके कंटेंट से वी आर नॉट अवेयर ऑफ. सो दिस इज द टोपोग्राफिकल थ्योरी ऑफ माइंड. देन ही ऑल्सो ट्राइड टू मेक अ connection between these 2 theories. So again you can see he said that id usually it is predominantly in the unconscious mind. Ego, again, some part is in the conscious, some part is in the preconscious, and there is some part even in the unconscious mind. In fact, ego uses defense mechanisms. We will discuss defense mechanisms. Ego uses defense mechanisms to balance the anxiety between id and superego, and many of these defense mechanisms are in the unconscious part. And again, if you look at the superego again is spanning throughout conscious, preconscious, and unconscious mind. So these were two important theories given by Sigmund Freud. Let's also discuss some of the other theories, especially related with nursing. So one is the Parse's human becoming theory. Now it guides the practice of nurses to focus on the quality of life as it is described and lived. So in fact, in this theory, you will see it states that the health or the illness, it is not because of cause and effect. In fact, it is because of the perception of view the person creates while living in this existence. So this is the Parse's human becoming theory. There is another theory, that is the universality theory. It describes the universal phenomena like space, time, matter, energy as an interpersonal bound by the universal force. Another important model you can remember is the Roy's adaptation model. In Roy's adaptation model, it is based on the physiological, psychological, sociological, and dependence-independence adaptive model. So basically, it states that the aim of nursing is to increase the compliance. So increase the compliance and life expectancy. So this is the Roy's adaptation model, and again very important, remember Newman's system model. Newman, it was given by Betty Newman, and according to this model, the stress reduction is the key focus, is the goal of the system model of nursing practice. So basically it focuses on the stressors, so what all stressors the person is dealing, and also the responses which the person do on those stressors. So this is the Newman's system model given by Betty Newman. So these are some other theories which you can remember. Now let's talk about some basic terminologies. Now what is that condition in which the patient is not aware of his condition? Patient may come and say that I'm not having an illness. तो इसको हम क्या कहते हैं? What is the term we use for this? So we know in psychiatric disorders, kabhi patient may not be aware of their illness. So this is known as insight. So here we can say that there is lack of insight. So when we divide psychiatric disorders, we have discussed that we can divide important psychiatric disorders into neurosis and psychosis. In neurosis, usually we know that the insight is present, while in psychosis, such as in schizophrenia, the insight may be absent. Now next is hallucination. Now what is hallucination? Now, please remember, when we talk about hallucination, hallucination is a problem of perception. It's an abnormality of perception. It is described as a disturbance in perception, as it is sensing perception without the presence of any external stimulus. So there is a false perception without any real or external stimuli. For example, the person may be hearing something or seeing something. There is no external stimuli, but patient is still experiencing or perceiving something. So this is known as hallucination. Hallucination we know can be of various types. कौन सी hallucinations हो सकती हैं? Remember, hallucinations can be auditory hallucination, मतलब patient को कुछ चीजें सुनाई दे रही हैं. It could be human voices, or it could be some animal voices, or maybe certain other sounds the person is hearing. For example, bell की आवाज सुनाई दे रही है, which others cannot hear. There is no external stimuli, but patient is perceiving something. So yeah, auditory hallucination. Remember, auditory hallucination is the most common hallucination. Then olfactory hallucination. Olfactory hallucination का मतलब है patient को smell आ रही है, although there is no external stimuli, but patient is experiencing a smell. Gustatory का मतलब है patient की tongue पे there is no food, but patient को taste आ रहा है. Tactile मतलब sense of touch. Patient is experiencing some sensation. फॉर एग्जाम्पल पेशेंट को इंसेक्ट्स क्रॉल होते हुए एक्सपीरियंस हो रहे हैं अपनी स्किन पर. दिस इज ऑल्सो नोन एज फॉर्मिकेशन. दिस इज ऑल्सो नोन एज फॉर्मिकेशन. फॉर्मिकेशन, पेशेंट सेज दैट आई कैन फील इंसेक्ट्स क्रॉलिंग ओवर और अंडर माई स्किन. दिस इज ऑल्सो समटाइम्स नोन एज, रिमेंबर इसे हम क्या कहते हैं? कोकेन बग्स, और ऑल्सो नोन एज मैग्नम बग्स. Cocaine bugs or magnum bugs, again, why we call it cocaine bugs? It can be seen in cocaine users. And also remember visual hallucination. Visual hallucination में क्या हो रहा है? Patient is seeing things not seen by others. Remember, overall most common hallucination is auditory hallucination. About visual hallucination, one important point you should remember, that visual hallucinations, if it is asked that in which conditions the most common hallucination is visual hallucination, remember in the organic mental disorders, visual hallucination are the most common hallucination. In fact, if visual hallucination is there in the question, try to see if there is any organic mental disorder they're talking about. So these are some important types of hallucination. Also there are some special types of hallucination. Special hallucination मतलब जो हमने hallucination की definition पढ़ी उससे थोड़ा सा different है, that is why we call them as special hallucination, such as reflex hallucination. रिफ्लेक्स hallucination को morbid synesthesia भी कहते हैं. So reflex hallucination, remember, is also known as morbid synesthesia. रिफ्लेक्स hallucination में क्या होता है? एक real stimulus is required. So एक real stimulus, it produces a hallucination in the same or different modality. Remember, in different modality. एक real stimulus patient experience करता है in one modality. For example, a patient says, सर जब भी मेरा मोबाइल फोन रिंग करता है, so he is hearing the ringtone of मोबाइल फोन, ये एक रियल स्टिमुलस है ऑडिटरी मोडालिटी में. Patient says, so whenever he experience this real stimulus in auditory modality, patient says, I can see someone in my room, जो किसी और को नहीं दिखाई देता. तो उसको एक विजुअल हेलुसिनेशन प्रोड्यूस हो रही है. रिमेंबर, हेलुसिनेशन किस मोडालिटी में? इन अ डिफरेंट मोडालिटी. तो इसको कहते हैं हम रिफ्लेक्स हेलुसिनेशन या फिर मॉर्बिड सिनेस्थीसिया. ये मिल सकता है इन यूज ऑफ हेलुसिनोजेंस लाइक LSD में, लाइसर्जिक एसिड डाइथाइलामाइड. देन देयर इज फंक्शनल हेलुसिनेशन. फंक्शनल हेलुसिनेशन में क्या होता है? अगेन एक रियल स्टिमुलस प्रोड्यूसेस अ हेलुसिनेशन, बट यहाँ पे सेम है या डिफरेंट इन द सेम मोडालिटी. फॉर एग्जाम्पल, पर्सन से सर जब भी मेरा मोबाइल फोन रिंग करता है वो एक रियल स्टिमुलस है, सबको सुनाई दे रहा है मोबाइल फोन. आई हियर अ वॉइस ऑफ अ पर्सन इन द रूम. तो ये क्या है? दिस इज फंक्शनल हेलुसिनेशन. जब सेम मोडालिटी में हेलुसिनेशन प्रोड्यूस हो रही है इसको कहते हैं फंक्शनल हेलुसिनेशन. देन देयर इज hypnagogic. So remember from the name, नाम में ही गो आ रहा है. पर्सन से so whenever I am about to sleep, जब मैं सोने लगता हूँ उससे पहले मुझे कुछ hallucination experience होती है. hypnagogic. hypnopompic hallucination में patient से so जब भी मैं उठता हूँ while coming out of sleep I experience hallucination. So ये hypnagogic and hypnopompic hallucination. Remember, ये hallucinations मिल सकती हैं in condition like narcolepsy. So narcolepsy में we may see. So there are 4 symptoms of narcolepsy. One of the symptoms is hypnagogic and hypnopompic hallucination. Then other hallucination include paranomic. Paranomic hallucination. This is also known as scenic hallucination. Paranomic या फिर इसे हम scenic hallucination भी कहते हैं. इसमें क्या होता है? Patient को जो visual hallucination हो रही है, he is seeing the entire scene. He is able to see the entire scene. For example, patient को पूरा एक battle का scene दिखाई दे रहा है या crucifixion का पूरा एक scene दिखाई दे रहा है. This is known as panoramic hallucination or scenic hallucination. So these are some special hallucination. Remember, जब हम hallucination की बात करते हैं, hallucination की जो characteristics हैं are having characteristic of all the characteristic जो एक real perception या normal perception में होती हैं. So remember, hallucinations are very clear to the person. Patient को वो बहुत clearly experience हो रही हैं, as vivid as real. Patient को hallucination कहाँ experience हो रही हैं? Remember, he is experiencing it in the external or outer objective space. In the outer objective space, person is experiencing these hallucinations. And remember, hallucinations, they are involuntary. That is, they are not under the control of the person. So these are some important points about hallucination. Now also let's talk about another important abnormality in perception, that is illusion. Now illusion भी एक perception की problem है. It is a false perception but in the presence of a real stimulus. For example, a person is sleeping and in the middle of the night वो उठता है और उसको अपने बेड के नीचे एक स्नेक दिखाई देता है. He see a snake under his bed. पर जब वो लाइट स्विच ऑन करता है उसको दिखता है अरे दिस इज नॉट अ स्नेक बट दिस इज एक्चुअली अ रोप. सो इसे हम कहते हैं इल्यूजन. सो ये जो स्नेक है, व्हाट इज दिस स्नेक? दिस स्नेक इज अ फॉल्स परसेप्शन, बट यहाँ पे रियल ऑब्जेक्ट है क्या, यहाँ पे रियल ऑब्जेक्ट है वो है रूप, सो इसे कहते हैं हम इल्यूशन. नाउ लेट्स डिस्कस अनदर इंपॉर्टेंट terminology, that is delusion. Now remember, delusion is an abnormality of thought. Hallucination is an abnormality of perception. Remember, delusion is an abnormality of thought. ये disturbance है thought process की. What is a delusion? We know delusion is a false, fixed, firm idea or belief. Patient के mind में एक false belief है, but वो fix हो गया है. It is held with extraordinary conviction. So even if there is evidence to contrary, आप उसको contrary evidence भी दो, but patient के mind में जो ये false belief आ गया, ये change नहीं हो रहा. This is delusion. For example, a patient says that I know my neighbor wants to kill me. Patient कह रहा है मेरा neighbor मुझे मारना चाहता है. ये false belief है. Family members कह रहे हैं नहीं sir, it is not true. Neighbors are so good people. Neighbor cannot harm anyone. But the patient is convinced कि my neighbor wants to kill me. Family members are trying to give him evidence that it is not true, but he is not getting convinced. तो ये क्या है? This is an example of delusion. और ये कौन सी delusion है? This is delusion of persecution. So delusion of persecution, remember, it is in fact delusion of persecution, remember, is the most common overall psychiatric disorder में सबसे common delusion कौन सा है? Delusion of persecution. Remember, persecution means to kill or to harm someone. So this is an example of delusion of persecution. Let's discuss some other examples of delusion. A belief that he or she is famous or having power. Patient को ऐसे false, big false claims patient कर रहा है कि I have, supernatural powers. I am very famous. So what is this delusion known as? Remember, this delusion is known as delusion of grandeur or delusion of grandiosity. Again, remember delusion और hallucination की जो हमने बात की. So both delusion, hallucination, these are psychotic symptoms. So these, remember, they are psychotic symptoms, can be seen in various conditions like psychotic disorders, like schizophrenia, and even in other conditions they can be seen. So remember, delusion of grandeur is a type of delusion. Delusion of grandeur again sometimes can be seen in even mania. Mania is a mood disorder we'll discuss. Even in those conditions also sometimes delusion can occur, such as delusion of grandiosity. A constant feeling of guilt for something. So patient is having this false belief that he has done something wrong, so there is a feeling of guilt. What is this delusion known as? Remember, this is delusion of guilt. Delusion of being dead or do not exist or have lost their internal organs. So sometimes patient have these delusions that he denies the existence of self or his family members. I don't have any organ in my body, I don't have a brain, I don't have an intestine, या फिर my family members are dead, or sometimes patient says the world is a dead place, ये मरे हुए लोगों की दुनिया है, everybody is dead here. So patient may have such delusion. This is known as delusion of nihilism. This is known as delusion of nihilism or delusion of negation. Also remember, sometimes this delusion, when it occurs with depression, then that is known as Cotard syndrome. So remember, delusion of nihilism is when patient denies existence of self or family members or the world around, and when this delusion is seen in depression, then that term is known as Cotard syndrome. So as we have discussed, next is delusion of persecution. So it's a delusion in which person thinks that he is being persecuted, somebody wants to kill me or somebody wants to harm me. ये है delusion of persecution. There are so many other delusions which we have earlier discussed. Next, let's talk about some other terms. That is catharsis. Catharsis is basically the process of releasing strong or repressed emotions. So sometimes, for example, venting out the emotions. So it can be done through various mediums like expressing emotions through art and various other methods. The person is releasing those strong or repressed emotion. Then what is abreaction? Abreaction is a psychoanalytical term for reliving an experience to release it emotionally. So basically it's a type of catharsis हम समझ सकते हैं, done by becoming conscious of repressed traumatic events. So यहाँ पे patient का release हो रहा है of those strong emotion and patient is also reliving that experience. तो उसको relive भी कर रहा है, इसे कहते हैं abreaction. The next term is abulia. Now abulia is a term usually used in neurology, very similar to avolition जो हम psychiatry में use करते हैं. Volition का मतलब होता है will power. So avolition मतलब decrease or absence of will power. So abulia is inability to act decisively or absence of will power. Very important term anhedonia. Anhedonia क्या होता है? Decrease or loss of interest or pleasure. सो पेशेंट हमारे पास आता है, पेशेंट में से दैट सर पहले जिन चीज़ों में मुझे इंटरेस्ट या प्लेजर आता था, अब उन चीज़ों में इंटरेस्ट या प्लेजर कम हो गया, इसे हम बोलते हैं एनीडोनिया। एनीडोनिया मिल सकता है इन कंडीशन लाइक डिप्रेशन। तो डिप्रेशन में जब हम निमोनिक डिस्कस करते हैं, साइज कैप्स विद डबल एस, सो SII जो सेकंड हम पॉइंट डिस्कस करते हैं वो है इंटरेस्ट, डिक्रीज इंटरेस्ट हो जाता है। रिमेंबर एनीडोनिया कैन ऑल्सो बी सीन इन स्किज़ोफ्रेनिया, इनफैक्ट इट इज वन ऑफ द नेगेटिव सिम्टम ऑफ स्किज़ोफ्रेनिया। नेक्स्ट टर्म इज alexithymia. Alexithymia का मतलब inability to recognize and describe feelings. Patient says I'm not able to recognize emotions and feelings, I'm not able to describe the feelings. ये है alexithymia. नेक्स्ट इंपॉर्टेंट टर्म इज ecolalia. देखो eco मतलब repeat, lalia means word, repetition of phrases or words heard. पेशेंट जो भी सुनता है उनको रिपीट करता है। हम पेशेंट से पूछते हैं व्हाट इज योर नेम, पेशेंट सेज व्हाट इज योर नेम, व्हाट डू यू डू, व्हाट डू यू डू, ये है ecolalia. ऑल्सो देर इज अनदर इंटरेस्टिंग फिनोमिना जो हम डिस्कस करते हैं। मैंने एक पेशेंट से पूछा व्हाट इज योर नेम, पेशेंट सेज माय नेम इज मुकेश, इट इज करेक्ट। व्हाट डू यू डू, माय नेम इज मुकेश। Where do you live? My name is Mukesh. Now he is repeating the same answer in all the other question. इसे हम बोलते हैं perseveration. Remember, perseveration is when the thought persists beyond the point of relevance. So एक thought अब बार बार persist हो रहा है जबकि वो बाकी सब question में relevant नहीं है, ये है perseveration. Remember two important conditions where you may get perseveration. One, first very important is organic mental disorder and another is schizophrenia. Let's discuss some more terms. Now, sometimes there is senseless repetition of same words or phrases over and over again. इसको हम बोलते हैं stereotypy. Now, stereotypy can be seen in movement. जैसे हम कैटाटोनिया में डिस्कस करते हैं, sometimes it can also occur in the verbal response. So, patient कुछ words, phrases बार बार repeat कर रहा है जो senseless हैं, इसे कहते हैं stereotypy. So, stereotypy can be defined as repetitive or ritualistic movement, posture or even utterance. So, stereotypy movement भी हो सकती है in which person is repeating or some odd movements again and again. So this is stereotypy, and sometimes it can also be seen verbally. Now when we talk about the movements, stereotypy में क्या होता है कि patient कुछ abnormal movements बार बार repeat कर रहे हैं. This is to be differentiated from another very similar phenomena जिसे हम कहते हैं मैनरिज्म. तो मैनरिज्म स्टीरियोटाइपी ये हम डिस्कस करते हैं कैटाटोनिया में. दोनों का मतलब है एबनॉर्मल मूवमेंट्स पेशेंट इज रिपीटिंग अगेन एंड अगेन. दोनों में डिफरेंस क्या है, नाम से हम याद रख सकते हैं. मैनरिज्म जो टर्म है वो मैनर से बना है. यहाँ पे जो मूवमेंट्स पेशेंट बार बार रिपीट कर रहे हैं उनका एक पर्पस है. फॉर एग्जाम्पल पेशेंट इज हैविंग दिस मूवमेंट अगेन एंड अगेन, सो विल से सर ये तो सैल्यूट मूवमेंट है बट अब ये रेपिटेटिव है, ऑड हो गया, ये है मैनरिज्म. स्टीरियोटाइपी में जो मूवमेंट्स हैं उनका कोई पर्पस नहीं है. सो सच मूवमेंट्स पेशेंट इज रिपीटिंग अगेन एंड अगेन, ये है स्टीरियोटाइपी. लेट्स डिस्कस सम मोर इंपॉर्टेंट टर्म्स. नेक्स्ट इज एग्राफिया. एज द नेम सजेस्ट, एग्राफिया का मतलब है डेफिसिट टू राइट. पैराफ्रीजिया is coming up with words that are jumbled and sentences that are meaningless. So patient कुछ jumbled up words बोल रहा है, sentences बोल रहा है जिनका कोई meaning नहीं है. Anomia, as the name suggests, deficit in naming. Aphemia, severely impaired fluency. Now let's discuss another interesting phenomena, apparently motiveless resistance to all commands. तो patient को जो भी आप command दे रहे हो, patient सब commands को resist कर रहा है. And sometimes the patient may even oppose these commands. तो आप patient को बोलते हो come forward, आगे आओ, patient either stands on his place या फिर पीछे चला जाता है. आप patient से पूछते हो आगे आओ और पीछे चला गया. तो can you appreciate यहाँ पे patient resist कर रहा है to all the commands. इसको हम बोलते हैं negativism. Negativism is an important phenomena which we have discussed in catatonia. Just opposite of negativism also you can remember, that is automatic obedience. Automatic obedience में क्या हो रहा है, as the name suggests, अब patient automatically obedient है. whatever I am telling the patient is doing even if it is harmful for him. so ये है automatic obedience and negativism. Now let's discuss posturing. So two important terms, we'll discuss posturing and cataplexy. So let's discuss two important terms, posturing and cataplexy. Now again these two terms we discuss in catatonia. इन दोनों terms का मतलब है कि person is maintaining a bizarre posture for a long time against gravity. Sometimes you will see in psychiatry patient may come with such postures and patient is maintaining this posture for a long time. So it can be posturing, it can be cataplexy. दोनों में difference क्या है? Remember, जो cataplexy है it is a पैसिव फिनोमिना। पैसिव फिनोमिना का मतलब है पेशेंट खुद इस पोस्चर में नहीं आया। सपोज एग्जामिनर हैज मेड द पेशेंट टू कम इन दिस पोस्चर, बट पेशेंट अब इसको मेंटेन कर रहा है, ये है कैटालेप्सी। जबकि पोस्चरिंग इट्स अ वॉलेंट्री, इट्स अ एक्टिव फिनोमिना, पेशेंट खुद ही इस पोस्चर में आया और अब उसको मेंटेन कर रहा है, तो ये है पोस्चरिंग। सो रिमेंबर पोस्चरिंग, कैटालेप्सी। प्लीज रिमेंबर ये है कैटालेप्सी। एक और सिमिलर टर्म, नाम थोड़ा सिमिलर है, कैटाप्लेक्सी, बट रिमेंबर कि कैटालेप्सी और कैटाप्लेक्सी डिफरेंट। कैटाप्लेक्सी कहाँ मिलता है? रिमेंबर कैटाप्लेक्सी इज सीन इन नार्कोलेप्सी। तो कैसे याद करेंगे? कैटालेप्सी इज सीन इन नार्कोलेप्सी, इट्स अ स्लीप डिसऑर्डर, एनआरईएम डिसऑर्डर। सो रिमेंबर कैटालेप्सी नार्कोलेप्सी में नहीं मिलता, सो नार्कोलेप्सी में डिफरेंट टर्म मिलता है, कैटाप्लेक्सी। सो व्हाट इज कैटाप्लेक्सी? सडन इनवॉलंटरी वीकनेस ऑफ द मसल, सडनली देयर इज लॉस ऑफ मसल टोन। वी नो कि आरईएम में देयर इज मसल टोन इज इन अ स्टेट ऑफ पैरालिसिस, सो नार्कोलेप्सी इज अ आरईएम डिसऑर्डर। तो यहाँ पे सडनली मसल टोन चला जाता है ऑफ डिफरेंट पार्ट ऑफ द बॉडी, रिजल्टिंग इन जॉ ड्रॉपिंग या फिर स्लर्ड स्पीच, लिम्पिंग ऑफ एक्सट्रीमिटीज, एंड ये ट्रिगर हो सकते हैं बाय इमोशनल आउटबर्स्ट। सो पर्सन लेट्स से बिकम्स वेरी इमोशनल एंड सडनली पेशेंट में हैव कैटाप्लेक्सी। सो रिमेंबर कैटाप्लेक्सी इज सीन इन नार्कोलेप्सी। देन व्हाट इज एप्रैक्सिया? रिमेंबर प्रैक्सिया का मतलब होता है मूवमेंट, एप्रैक्सिया मतलब इनएबिलिटी टू परफॉर्म सम ऑफ द स्किल्ड मोटर एक्टिविटी ऑन कमांड डिस्पाइट हैविंग इंटैक्ट स्ट्रेंथ एंड सेंसेशन। मतलब मोटर वीकनेस नहीं है बट पर्सन इज नॉट एबल टू परफॉर्म सर्टन स्किल्ड मोटर एक्टिविटी, जैसे कि पर्सन इज नॉट एबल टू कोम्ब हिज हेयर, पर्सन इज नॉट एबल टू बटन अनबटन हिज क्लोथ्स, तो ये मूवमेंट्स पेशेंट नहीं कर पा रहा है, इसे कहते हैं एप्रैक्सिया। अगेन एप्रैक्सिया is a cognitive impairment जो मिल सकता है in condition like dementia. In fact dementia में we talk about certain important symptoms जैसे कि amnesia. Amnesia मतलब not able to remember, so loss of memory is there. Then there is apraxia. So apraxia is also a cognitive impairment जो dementia में मिल सकती है. Then person can have aphasia. Aphasia में क्या होता है? In aphasia there is impairment in speech and also person may have agnosia. What is agnosia? Person is not able to identify object. For example, patient को हम ये object दिखाते हैं, वो identify नहीं कर पाता, या फिर हम patient को ask to identify faces, not able to identify faces. So this is agnosia. So in fact, these are some of the cognitive impairment जो मिल सकता है in dementia. So remember apraxia. Now what is stupor? Stupor is a state of diminished consciousness in which patient remains mute and still with the eyes open. So patient in stupor की जो साइकोमोटर एक्टिविटी है, रिमेंबर साइकोमोटर एक्टिविटी सिग्निफिकेंटली रिड्यूस्ड। साइकी का मतलब है माइंड की एक्टिविटी, मोटर मतलब बॉडी की एक्टिविटी, दोनों डिक्रीज हो गई हैं। सो पर्सन में स्पीक वेरी लिटल, सो देयर इज म्यूटिज्म एंड आल्सो इज नॉट शोइंग मूवमेंट। सो समटाइम्स अनदर टर्म व्हिच इज यूज्ड इज akinetic mutism. So sometimes in medicine and neurology we use this term akinetic mutism for stupor. Again remember stupor is also one of the symptoms जो मिल सकता है in catatonia. Another important symptom which we'll discuss, this is important, that is waxy flexibility. So waxy flexibility, again from the name we can remember, flexible like a wax candle. So it is defined that when there is initial resistance to an induced movement before gradually allowing himself to be postured. ये है waxy flexibility. Person is bending like a wax candle. Suppose ये एक wax candle है, जब इसको हम बेंड करने की कोशिश करते हैं तो इनिशियल रेजिस्टेंस आता है, उसके बाद जैसा हम चाहें उसको बेंड कर सकते हैं, ये है वैक्सी फ्लेक्सिबिलिटी। सपोज ये पेशेंट का हैंड है, हमने इनिशियली लिया, इनिशियल रेजिस्टेंस थी बट उसके बाद हमने जैसा चाहे उसको अब बेंड कर दिया, ये है वैक्सी फ्लेक्सिबिलिटी। तो पेशेंट नंबर ए, लेट अस से कि हम उसको मूव करने की कोशिश कर रहे हैं, इनिशियल रेजिस्टेंस है बट अब हम उसको जैसा मर्जी चाहे बेंड कर सकते हैं, ये है वैक्सी फ्लेक्सिबिलिटी। जैसे हमने हाथ हटाया मे बी पर्सन में मेंटेन इट फॉर सम टाइम और धीरे धीरे मे बी द हैंड विल कम डाउन, ये वैक्सी फ्लेक्सिबिलिटी। लेट अस सी पेशेंट नंबर बी। हमने पेशेंट बी का हैंड लिया और उसको हमने मूव किया, कोई रेजिस्टेंस नहीं है, हमने इस पोस्चर में लाके उसको हटा दिया अपना हाथ, नाउ ही इज मेंटेनिंग दिस पोस्चर। ये क्या है? दिस इज कैटालेप्सी। आई होप इट इज क्लियर। वैक्सी फ्लेक्सिबिलिटी में यू विल सी दैट देयर इज इनिशियल रेजिस्टेंस। लेट्स डिस्कस वन मोर टर्म, दैट इज कॉन्फैबुलेशन। नाउ फर्स्ट ऑफ ऑल यू शुड नो कॉन्फैबुलेशन क्या होता है। इन कॉन्फैबुलेशन अगेन द पर्सन is not able to remember things, so there is deficit in the memory. It could be because of injury or it could be because of other condition. Very important one condition you should remember in Korsakoff syndrome. Korsakoff syndrome जो हम डिस्कस करते हैं अल्कोहल से रिलेटेड, so remember in Korsakoff syndrome which is alcohol induced amnestic disorder, इसमें हम कॉन्फेबुलेशन एक सिम्टम हमें मिल सकता है in which the memory gaps are unintentionally and automatically filled with fabricated and misleading information. So filling of memory gaps with false stories, ये है confabulation, which can be seen in Korsakoff syndrome. So for example, a husband returns home in the morning, wife asks where were you, husband को नहीं याद, he starts making stories कि मैं friend के साथ था, I went to a party, फिर मैं उसके घर गया, मैं वापस morning में आ गया. So please remember, जो memory gaps हैं, he is not intentionally filling them, उसको भी लगता है कि उसने वो सारी चीजें की. So this is confabulation which can be seen in Korsakoff syndrome. Now let's talk about certain tools, tests or scales used in the assessment. So we know psychiatric patient के assessment को, examination को हम क्या कहते हैं? Remember it is known as MSC. MSC का मतलब क्या है? Mental Status Examination. So remember MSC is the examination of psychiatric patient. So it's a standardized format जिसमें clinician records the psychiatric signs and symptoms present at the time of patient's interview. तो MSC के कुछ important parameters जो हम assess करते हैं, there is general appearance, behavior, attitude, psychomotor activity देखते हैं. psychomotor activity मतलब mind की और body की activity. It could be slow, it could be fast, it could be normal. Then mood and affect, very important. We talk about mood and affect. मूड और अफेक्ट जो टर्म्स है दोनों रिलेटेड हैं विद इमोशंस, बट दोनों में इंपॉर्टेंट डिफरेंस है. सो बोथ दीज टर्म्स आर रिलेटेड विद द फीलिंग्स और द इमोशंस. मूड क्या है? मूड इज अ इंटरनल फिनोमेना. इट्स अ पर्सिस्टेंट परवेसिव इमोशनल स्टेट which the patient is feeling from within. For example, a patient says for the past few days or weeks I am feeling sad. ये है मूड. अफेक्ट क्या है? एक्सप्रेशन ऑफ इमोशन. हमारे जो इमोशंस है, फीलिंग्स है, हमारे फेस पे, हमारी बॉडी लैंग्वेज पे एक्सप्रेस होते हैं, इसे हम कहते हैं अफेक्ट. रिमेंबर टू इंपॉर्टेंट एबनॉर्मैलिटीज ऑफ अफेक्ट यू शुड रिमेंबर. एक है फ्लैट अफेक्ट. को फ्लैट अफेक्ट साइकाइट्री में ऑलवेज से रिमेंबर द नेम एंड यू विल अंडरस्टैंड द कॉन्सेप्ट. देखो व्हाट डू मीन बाय फ्लैट. So whenever we see a ECG of a person who is alive, you will see such waves. How is the ECG of a person who is dead? It's a flat line. इसका मतलब है flat affect. मतलब emotions are not changing. Suppose we are discussing some sad moments of a patient's life. Let us say recently somebody died in his family. There is some sad moment. So we are discussing कुछ sad moment, उसकी life के दुखी moments discuss कर रहे हैं, but patient is looking like this. There is no change in the affect. So this is फ्लैट अफेक्ट. लेट अस से नाउ आई एम डिस्कसिंग सम हैप्पी मोमेंट्स ऑफ हिज लाइफ. तो उसकी लाइफ के कुछ खुशी वाले पल में डिस्कस कर रहा हूँ. रिसेंटली वो प्रमोट हुआ, ही बिकेम अ फादर, बट अगेन ही इज लुकिंग लाइक दिस. देयर इज नो चेंज इन द अफेक्ट. इसे हम कहते हैं फ्लैट अफेक्ट. इसका जस्ट ऑपोजिट रिमेंबर वन मोर इंपॉर्टेंट एबनॉर्मैलिटी, लेबाइल अफेक्ट. लेबाइल, लेबिलिटी का मतलब है समथिंग विच इज चेंजिंग रैपिडली. So labile affect, you can remember here there is rapid and abrupt changes of emotion. You're talking to a patient, आप उससे इंटरव्यू कर रहे हो, आपने कोई जोक क्रैक नहीं किया, पेशेंट ने कोई जोक क्रैक नहीं किया, हमारे आसपास कुछ भी फनी नहीं हुआ, बट पेशेंट स्टार्ट्स लाफिंग, देन ही स्टार्ट्स क्राइंग, देन अगेन सडनली स्टार्ट्स लाफिंग. ये क्या है? लेबाइल अफेक्ट. रिमेंबर दिस इज लेबाइल अफेक्ट और लेबिलिटी. फ्लैट अफेक्ट रिमेंबर वन इंपॉर्टेंट कंडीशन जहां मिल सकता है, दैट इज स्किज़ोफ्रेनिया. Labile affect, remember some condition, one is mania or you can call bipolar disorder, and even in organic mental disorder. Then next heading is speech. हम patient की speech को observe करते हैं, assess करते हैं. Very important is the disorders of thought. Thought की जो disorders हैं हम उनको 4 domains में divide करते हैं. Flow में, so there is problem in the flow. In flow, remember some important phenomena like flight of ideas. So in flight of ideas, as the name suggests, patient के जो thoughts हैं बहुत fast आ रहे हैं. So patient, you ask a question to the patient, patient के mind में thoughts बहुत fast आ रहे हैं. So he will speak very fast. Things may not make much sense and ultimately he will not answer your question. So ये कहते हैं goal is not reached. ये है flight of ideas. Flight of ideas can be seen in condition like mania. And flight of ideas में जब आप patient की speech को सुनोगे, उसके thoughts को सुनोगे, you will see that there is some connection. This connection can be by chance. For example, a patient is speaking like this: my name is Virat, I like playing cricket. Cricket is a game of gentlemen. Gentleman is my friend Mukesh. Mukesh smokes cigarette. Cigarette causes cancer. Cancer is my zodiac sign. You will see the thoughts may be connected by chance, or there may be some connection known as clang association, मतलब rhyming words. So patient may speak like this: Ram can sing, birds have wing, I am the king, phone goes string string, the weather is spring. So this is flight of ideas. Can be seen in condition like mania. Then there are other abnormalities of flow. Next abnormality is content. Content में one very important abnormality which we discuss is delusion. Then there is abnormality of form. Form means organization. So जब organization में problem होती है, we say it's a problem of form, such as formal thought disorders like loosening of association, derailment, tangentiality, neologism. ये सारे हैं formal thought disorders. And then there is abnormality of possession. Remember, possession में an important abnormality which we discuss is obsession. So OCD में जो obsessions आते हैं, it's a problem of possession. And also another important phenomenon, thought alienation. Thought alienation में क्या होता है? In thought alienation, also known as passivity of thought. यहाँ पे patient thinks or patient experiences that उसके thoughts are influenced by outside. So patient may say that somebody is inserting thoughts in me, thought insertion. Somebody is withdrawing my thought, इसको कहते हैं thought withdrawal. या फिर मेरे thought बाहर broadcast हो रहे हैं, thought broadcast. ये है thought alienation. So these are important headings of thought. Then we have disorders of perception. इसमें important हमने discuss किया hallucination. Remember, hallucination और delusion दोनों psychotic symptom है. Delusion problem है thought की, hallucination problem है perception की. I'll give you one example. एक पेशेंट को लगता है कि माई नेबर वॉन्ट्स टू किल मी, ही इज कन्विंस्ड, उसका ये फॉल्स बिलीफ है कि मेरा नेबर मुझे मारना चाहता है, तो ये क्या है? डिल्यूजन. एक और एग्जांपल, पेशेंट से सर आई कैन हियर द वॉइसेस ऑफ माय नेबर्स प्लानिंग टू किल मी. यहाँ पे उसको आवाजें आ रही हैं अपने नेबर्स की जो प्लान कर रहे हैं उसको मारने का, ये यहाँ पे वॉइसेस इज हियरिंग. सो दिस इज hallucination. Illusion is also an abnormality of perception. One more abnormality of perception you can remember is pseudo hallucination. So one more abnormality you can remember is pseudo hallucination. Hallucination और pseudo hallucination are very similar. दोनों बहुत क्लियर हैं पेशेंट को, दोनों इनवॉलेंट्री हैं, दोनों होते हैं विदाउट एनी एक्सटर्नल स्टिमुलस. दोनों में डिफरेंस क्या है? हालुसिनेशन पेशेंट कह रहे हैं मुझे एक्सपीरियंस हो रही है इन द आउटर ऑब्जेक्टिव स्पेस, सर मुझे बाहर से आवाजें आ रही, ये है हालुसिनेशन. Pseudo hallucination patient is experiencing it in the inner subjective space. For example, patient says I can hear a voice बहुत clearly, मेरे कंट्रोल में नहीं है बट मुझे अपने अंदर से आ रही है, in my mind. So ये है pseudo hallucination. Then some other headings of MSC include the higher mental function like memory, attention, intelligence, abstract thinking. Abstract thinking का मतलब क्या होता है? Abstract thinking का मतलब ability to understand hidden meaning or to form concept. ये है abstract thinking. Abstract thinking को टेस्ट करने के लिए two important test you should remember. कौन कौन से टेस्ट हैं? One is the proverb testing. हम पेशेंट से कुछ proverbs का मीनिंग पूछते हैं, like मुहावरों का मीनिंग. And also there is one more test known as similarity testing. So there are two tests of abstract thinking. And then there is judgment. Judgment का मतलब है ability to take a decision based on the circumstances. So again there are various types of judgment. One important judgment remember is test judgment. टेस्ट जजमेंट में हम पेशेंट को एक हाइपोथेटिकल सिचुएशन देते हैं और उससे पूछते हैं इस सिचुएशन में क्या करोगे. फॉर एग्जाम्पल वी आस्क द फायर प्रॉब्लम दैट इफ योर नेबर्स हाउस कैचेस फायर व्हाट विल यू डू. नॉर्मली यू विल से सर आई विल सेव द नेबर्स, आई विल कॉल द फायर ब्रिगेड. सो दिस इज टेलिंग मी दैट आपकी टेस्ट जजमेंट इंटैक्ट है. सपोज अ पेशेंट सेज सर व्हाट आई विल डू, आई विल पोर कैरोसिन ऑन द फायर. तो ये जजमेंट टेस्ट जजमेंट इंटैक्ट है, इम्पेयर्ड है. देन विल से कि जो टेस्ट जजमेंट है वो impaired. Remember again it can be impaired in condition like psychosis. So these are some important points or some important tests which we use to assess these functions. And lastly there is insight. Lastly remember insight. So we ask about the awareness of the illness, whether person is aware of the illness. Neurosis may usually insight is present and in psychosis insight may be absent. Now what is ideas? What is ideas? Remember it stands for the Indian Disability Evaluation and Assessment Scale. So basically it helps to evaluate and assess the disability. Now CAGE questionnaire, what is CAGE questionnaire? It is used for screening drinking problem or potential alcohol problem. So we ask these 4 questions. So whether do you feel the need to cut down on your drinking? Do you feel annoyed when people tell you about your drinking? Or do you feel guilt about drinking, or do you use it as an eye opener in the morning? तो अगर इनमें से किन्हीं भी चार में से दो का आंसर 2 or more is yes, then that is suggesting maybe person may have a alcohol problem, and again we need to further assess the problem. So it's a screening tool. So it's cage questionnaire जो हम यूज करते हैं for screening drinking problem. Now also remember MSC क्या था? MSC was mental status examination. ये psychiatric patient के assessment को हम बोलते हैं MSC. Then there is something known as MMSC, that is mini mental state examination. This is a screening tool जो हम यूज करते हैं to assess cognitive functions. So cognitive functions may be impaired in organic mental disorder जैसे delirium में, dementia में. So MMSC हम यूज करते हैं to assess cognitive function. दोनों का नाम सिमिलर है, MSC and MMSC, बट रिमेंबर दोनों बहुत डिफरेंट है. MMSC का टोटल स्कोर कितना होता है? टोटल स्कोर ऑफ MMSC is 30. Now there is also हिंदी adaptation of this MMSC जिसे हम बोलते हैं हिंदी मेंटल स्टेट एग्जामिनेशन, जिसको दिया था गैंगली एट ऑल ने, मैरी गैंगली. इट्स अ स्क्रीनिंग टेस्ट फॉर कॉग्निटिव इम्पेयरमेंट. सो इट्स अ हिंदी एडेप्टेशन. So MMSC, as we have discussed, it is used to evaluate the cognitive functions of illnesses जैसे कि delirium, dementia में, and it has a total score of 30. So remember इसका total score है 30. Some of the scales which is used in behavioral assessment of children in psychology, remember some of these scales like Vinland Adaptive Behavior Scale. Then there is the Vanderbilt Assessment Scale, Behavioral Assessment System for Children. So these are some important scales for children. Now let's talk about the next topic. Let's discuss few points about sleep disorders. Now sleep, we know, is the sleep cycle is controlled by the suprachiasmatic nucleus in the brain, and we know sleep is divided into two stages. So कौन सी दो stages हैं sleep की? One is the NREM, that is the non-rapid eye movement, and one is REM. So sleep again can be measured by various types of brain waves that occur during different stages of sleep. So based on the EEG, so there are various parameters which we use to divide these stages. One is the EEG, that is the electroencephalogram. हम brain में वो ECG क्या होता है? Electrocardiogram. It measures the electrical activity of the heart. EEG क्या होता है? It is electroencephalogram. It measures the electrical activity of the brain. So हम EEG की फाइंडिंग्स के बेसिस पे डिवाइड करते हैं स्टेजेस को. ऑल्सो वी सी EMG, दैट इज इलेक्ट्रोमायोग्राम, मसल एक्टिविटी के बेसिस में. ऑल्सो EOG, दैट इज द इलेक्ट्रोओक्यूलोग्राम, आई मूवमेंट्स की एक्टिविटीज के बेसिस पे हमने इन स्टेजेस को डिवाइड किया. So NREM and REM. NREM is further divided into three different stages: N1, N2 and N3. Let's discuss some important waves which we see on EEG in these important stages. So remember N1. So when we are sleeping, so suppose in the night time जब आप सोने लगते हो, जो पहली स्टेज हम इनकाउंटर करते हैं वो है N1. So you can remember transition wakeful से स्लीप स्टेज में हम ट्रांजिशन कर रहे हैं. सो रिमेंबर T से ट्रांजिशन N1 में जो वेव मिलती है, T से रिमेंबर थीटा वेव. N2 वेरी इंपॉर्टेंट, N2 है. सो टू इंपॉर्टेंट EG फाइंडिंग्स हमें मिलती हैं. एक होता है स्लीप स्पिंडल. स्लीप स्पिंडल का मतलब है सडन बर्स्ट ऑफ सच एक्टिविटी, सडनली देयर इज बर्स्ट ऑफ एक्टिविटी. सो दिस इज स्लीप स्पिंडल. एंड ऑल्सो K कॉम्प्लेक्सेस. व्हाट आर K कॉम्प्लेक्सेस? दिस शार्प पॉजिटिव एंड नेगेटिव वेव, ये हैं K कॉम्प्लेक्सेस. N3 को हम डीप स्लीप भी कहते हैं, रिमेंबर. So D for deep, remember D for delta waves. So you may see these slow but high amplitude waves. So these are delta waves. REM में interestingly, so we are in N1, N2, N3, then we go in REM and then these cycles get repeated. Remember REM, although we are sleeping, but EEG में कौन सी waves मिलते हैं? We see beta and alpha waves. These waves जो मिलती हैं when we are awake. So beta waves we see normally when we are awake, when the eyes are open. So eyes are open. Alpha waves also they are seen when we are awake, when the eyes are closed. So see this, REM में है हम, but the brain is showing activity of the brain when we are in the wakeful state. So this is REM. So that is why हम REM को क्या बोलते हैं? Paradoxical sleep. So that is why REM sleep is also known as paradoxical sleep. And very interesting point you can remember. So what nature has done, when we are in REM, so our brain is showing very fast activity. So when we are in REM, what if we start moving? We may hurt ourselves. So what nature has done, that when we are in REM, the muscle tone is in state of paralysis, you will see that there is no muscle movement. So EMG पे क्या मिलेगा? The movements will not be seen on EMG. So we have discussed important EEG finding. EMG I've just discussed कि REM में EMG में they will show no activity, but NREM में you will see some movements. EOG electrooculogram में what you will find, again you can just see the name. आप सिर्फ नाम देखो. NREM का मतलब है non rapid eye movement. So from the basis of the eye movement we have given the name. So non rapid eye movement मतलब यहाँ पे जो eye movements है वो slow होंगी. REM में rapid eye movement में EOG में fast activity मिलेगा. So sleep cycle generally consists of REM and NREM sleep. REM sleep, also known as rapid eye movement sleep, it occurs in beta rhythm as we have discussed. Now dreams we see in REM and NREM, but sometimes when you wake up in the morning you remember the dream, and sometimes आपको dream नहीं याद रहते. So remember, dreams of REM, they are remembered. So we can remember it like this. Dreams of REM are remembered, while dreams of NREM are not remembered. So remember these important points. So dreams of NREM are not remembered. In some patient, bruxism is what? Grinding of teeth. Again, there is movement. So when movement is there, that means it is NREM. So it can be seen in stage 2. Narcolepsy is a disorder characterized by excessive daytime sleepiness. So patient has excessive daytime sleepiness. Then there are other symptoms also. Then there is cataplexy, which we have already discussed. Cataplexy. Remember, narcolepsy में catalepsy नहीं मिलता, cataplexy मिलता है. Then patient may also have sleep paralysis. Sleep paralysis का मतलब है paralysis after getting up from sleep. So person wakes up, but patient observe करता है maybe for few moments that he is not able to move the body, as if REM has entered the wakeful state. So person may not be able to move the body for some time. इसे कहते हैं sleep paralysis. And just think of the fourth symptom we have discussed in special hallucination. कौन सी? Hypnagogic and hypnopompic hallucination. Again, these are 4 important symptoms of narcolepsy. And we know narcolepsy में हम देख पा रहे हैं REM के characteristic. It is a REM sleep disorder. Now, insomnia क्या होता है? Insomnia when the person is having decrease in the quality या quantity of sleep. So patient may say, sir, I am not able to sleep. The duration has decreased. Sir, earlier my sleep time was 8 hours. अब ये कम होके 4 hours हो गया. तो quantity में कमी हो सकती है या फिर quality में. Person says, I have slept for entire duration of my sleep, but when I wake up in the morning, मुझे freshness feel नहीं होती. So quality या quantity decrease होना, इसे कहते हैं insomnia. It could be प्रॉब्लम इन इनिशिएशन. पेशेंट से सर मैं सो नहीं पा रहा, इनिशिएशन में प्रॉब्लम है, या फिर मेंटेनेंस में प्रॉब्लम है, सर बीच बीच में मेरी आंख खुल जाती है. और इट मे बी द पेशेंट में से दैट आई वेक अप 2 hours बिफोर माई यूजुअल टाइम, सो अर्ली मॉर्निंग इंसोम्निया. सो इट मे बी प्रॉब्लम इन इनिशिएशन, मेंटेनेंस, और इट कैन बी द पर्सन इज वेकिंग अप एटलीस्ट 2 hours बिफोर द नॉर्मल टाइम. सो दिस इज इंसोम्निया. देन लेट्स डिस्कस व्हाट इज स्लीप एपनिया. स्लीप एपनिया का मतलब है देयर इज cessation of airflow at the nostrils for 10 seconds or more. So breathing stops and restarts multiple times during the sleep. Sleep apnea. Again, sleep apnea can be of various types, such as there is obstructive sleep apnea, in which we say there is less than 5 obstructive apnea per hour. So obstructive sleep apnea. Then there can be central sleep apnea, in which the apnea episodes are 5 plus episodes per hour. So sleep apnea is there. Then somnambulism. See, somna means sleep, ambulism means movement. This is also known as sleepwalking. Sleepwalking. Now what happens in somnambulism? Person is sleeping but he gets up from the bed, starts moving. So there is movement in sleep. Person may have movements like he is moving, or may have even complex movements like he goes in the kitchen, refrigerator का door open किया, piece of cake निकाला और table पे रख दिया. So patient may even have these complex motor movements, but see, throughout this the person is sleeping, so person is unconscious. So ये है somnambulism. Again, how to remember? See, movements हो रही हैं, so it's a disorder in which movement is occurring, so it is NREM or REM. Remember, it is NREM. So these are some important sleep disorders. So there are so many other NREM disorders, जैसे कि somniloquy, that is sleep talking. Bruxism we have discussed. Then there is night terror. The person gets up during the sleep, appears all scared. He's appearing panic symptom may be there, as if he has seen a bad dream. But does he remember the dream? Remember ये NREM है, so it does not remember the dream. So these were some important disorders of NREM. And one important disorder we have discussed of REM, narcolepsy. Then one more disorder of REM you can remember, that is nightmare disorder. Nightmare disorder is like night terror. Person in the sleep, he appears frightened as if he has seen a bad dream. But does he remember the dream? हाँ, ये REM disorder है, so remember he remembers the dream. So these were some important points about sleep disorder. Let's discuss the next topic, that is schizophrenia. Now schizophrenia is a psychiatric disorder, and the word schizophrenia is coined by two words. Schizo का मतलब होता है split and phrenia means mind. So schizophrenia means there is split in the mind. And who coined the term schizophrenia? We discussed previously. Remember, it is Eugene Bleuler जिन्होंने term coin किया था schizophrenia का. And also one more important contribution, he gave Bleuler's 4 A's. So 4 A's are of schizophrenia. Bleuler's 4 A's. So what are these 4 A's? Remember, 1 A is affect disturbance. So there is disturbance in affect such as affective flattening. So there is disturbance of affect. Another A, remember, there is affect disturbance. So association disturbance. So second, remember, is association disturbance. So for example, loosening of association. So that can be seen. Next A is autism. Now here autism means the person is living in a fantasy world. Patient may be having illogical thinking, may appear socially withdrawn. So autism. And one more A is ambivalence, when he is not able to decide in his thinking. For example, there is a pen on the table and person is staring for hours and hours, thinking in his mind, should I pick it up or not? So ये है ambivalence. So ये हैं 4 important A's of Bleuler. In schizophrenia, again, the symptoms can be divided into various categories. One of the categories is positive symptom and negative symptom. Now, positive symptom of schizophrenia include symptoms such as delusions, hallucination, and other symptoms like agitation, hostility, aggression. So these are positive symptoms of schizophrenia. And one of the cause of positive symptom, we read about this, that increase of dopamine in the mesolimbic pathway. So positive symptom. Then we also have negative symptoms of schizophrenia. Now in negative symptom of schizophrenia, we know one of the reason is decrease of dopamine in the mesocortical pathway. So negative symptoms of schizophrenia we have already covered. What all symptoms we have already discussed? Let's see. We have talked about affective flattening, anhedonia. So these are negative symptoms. Also alogia. Logia means, remember, logia means the word. So alogia means decrease in the speech. So patient is speaking very less. Anhedonia, decrease interest. Affective flattening, there is decrease in the expression of emotion. Also remember asociality. Asociality, that is the person is having decrease in socialization. Avolition is decrease in willpower. Patient may also have attentional impairment, even apathy can be seen. So these are some important negative symptoms of schizophrenia. Social skills training may be required or done for negative symptoms. So there may be again problems in social skills, so social skill training may be given. Delusion in schizophrenia, again delusions can be bizarre delusions, can be non-bizarre delusions. Bizarre delusion means delusions. So bizarre and non-bizarre, these are delusions. Bizarre delusion means that in these delusions, when you hear about the content, you will feel that they are scientifically impossible. For example, patient thinks that somebody from another galaxy has implanted a chip in me and he wants to kill me. So this may appear scientifically impossible. इसे हम कहते हैं bizarre delusion. And non-bizarre delusion का मतलब क्या है? Delusions हैं, they are false but may be possible. For example, patient says my wife is having an affair with the neighbor. यह है delusion of infidelity. तो यहाँ पे although it is false in the case of the patient, but it still may be true. So ये है non-bizarre. So sometimes this may be asked कि इसमें से कौन सा bizarre है, कौन सा non-bizarre. So you may be asked. Now in schizophrenia, you may find bizarre delusion, but even non-bizarre delusions can be seen. Well, in delusional disorder, usually you will see non-bizarre delusion. Now this difference, now we don't use this difference much, but earlier it was thought that अगर patient में bizarre delusion है तो DSM-4 used to say make a diagnosis of schizophrenia. But now we know even bizarre and non-bizarre delusion, these can be seen in schizophrenia and even delusional disorder. Now let's discuss phases of development of schizophrenia. Now patient has come to us, let us say for the past 6-7 months with schizophrenia. Let us say a 24-year-old male has come to us with schizophrenia. Family members say that we have been seeing the symptoms since past 7 months. Now we know according to DSM, to make a diagnosis of schizophrenia, duration should be at least 6 months. So here the criteria is getting fulfilled. But when you take a history, a detailed history, you may see that there may be certain phases of development of schizophrenia. So let's talk about these phases. Now let us say on the y-axis I've taken the functioning, and this is 100% functioning. So this is normal functioning. So usually you will see that person before the onset of symptoms may have pre-morbid phase. So morbid means illness, pre-morbid phase. So you may see in the pre-morbid personality, the person may have very mild or very mild symptom may be there. Person may appear very shy, withdrawal, poor peer relationship, poor school performance. So there may be some degree of impairment which may be seen in the beginning. So this is the first stage, that is the pre-morbid phase. Then second is the prodromal phase. So prodromal means, before the development of full blown symptom, there may be certain subtle symptoms you may see. So these may be certain subtle symptoms family members may report in this scenario. So in this case, the family members may say that in the pre-morbid stage, in the childhood, we saw certain changes, we saw certain features like he was very shy, withdrawn, had poor relationship, and gradually they also notice certain subtle changes in the prodromal phase. Now this prodromal phase may be even 1 year or longer before the onset of the symptoms, and there may be more functional impairment you may see in this scenario, and certain non-specific symptoms, certain changes in behavior, becoming more irritable, maybe having more sleep problems, maybe sometimes having certain behavioral problems. These symptoms may be seen, and then there may be subsequently onset of symptoms. So then there may be the onset of the first symptoms. So there is the onset phase, there is the onset of symptoms, that is schizophrenia ke symptoms would develop. And we know the symptoms of schizophrenia, remember we have talked about with the mnemonic Dhadkan. So you can remember it from the name of the movie Dhadkan. What are the symptoms of schizophrenia? Delusions, hallucination, disorganized speech, catatonic symptoms, negative symptoms. And in DSM-5, the diagnosis is 6 months, while in ICD-11, the diagnosis duration is 1 month. So there is onset of symptoms, so onset phase, and gradually the symptoms may progress. So progressive phase, so there may be periods of remission and exacerbation. Symptom may increase, decrease. So these are the phases. And also remember, lastly, there may also be a residual phase. Residual phase, so there may be mild symptoms may still remain. So there may be even residual phase. So remember, these are some important stages or phases of development of schizophrenia. Now let's talk about some other points in the management. Now we know antipsychotics are the drugs we use in the management of schizophrenia. Schizophrenia is a psychotic illness. We use antipsychotics in the management, and these antipsychotics can be divided into the typical and the atypical antipsychotic. Typical yani first generation, atypical yani second generation antipsychotics. Now the typical antipsychotics, the first generation antipsychotics, they are dopamine blockers. So they are D2 antagonist. So they are D2 antagonist, and these typical antipsychotics may have EPS, that is extrapyramidal side effects. So we know that extrapyramidal side effects occur because of blockage of D2 receptors, and we have talked about these important EPS with the mnemonic DP at night. So dance party at night. So D से क्या है? Dystonia, that is acute dystonia, sudden contraction of a group of muscle. P is pseudo Parkinsonism, drug induced Parkinsonism. So person may have tremors, rigidity, bradykinesia, such movements. A, remember akathisia. Akathisia का मतलब है restlessness. सबसे common, if they ask you which is the most common EPS, remember it is akathisia. The person is restless. सब्जेक्टिवली पेशेंट विल रिपोर्ट कि मुझे अंदर से भी रेस्टलेस फील हो रहा है, और ऑब्जेक्टिवली जब आप बाहर से देखोगे पेशेंट विल अपीयर वेरी रेस्टलेस, पेशेंट इज नॉट एबल टू स्टे स्टिल, कंटिन्यूअसली मे बी मूविंग. तो ये है एक्स्थीसिया. देन टी फॉर टार्डिव डिस्काइनेसिया. टार्डिव का मतलब होता है लॉन्ग टर्म यूज. सो आपको हिस्ट्री मिलेगा कि पेशेंट इज टेकिंग द एंटीसाइकोटिक फॉर अ लॉन्ग ड्यूरेशन. एंड डिस्काइनेसिया सर्टन एबनॉर्मल मूवमेंट लाइक च्यूइंग मूवमेंट, लिप स्मैकिंग मूवमेंट, टंग प्रोट्रूजन मूवमेंट, या पियानो प्लेइंग लाइक मूवमेंट, हैंड मूवमेंट्स आपको मिलेंगे. ये टार्डिव डिस्काइनेसिया. एन वेरी इंपॉर्टेंट इज NMS, that is neuroleptic malignant syndrome. Now neuroleptic malignant syndrome, as the name suggests, malignant means now this is an emergency. So these are severe symptoms characterized by patient will have hyperthermia, muscle rigidity, increase in the CPK levels may be increased, and also autonomic dysregulation may be there, confusion may be there. Patient may also have deranged LFTs, may be deranged, even the TLC count may be increased. It's an emergency, remember NMS. So these are some important EPS. Usually EPS are more with the first generation and usually less with the second generation. But of course, second generation antipsychotic can also cause EPS. Acute dystonia, as we discussed, is a EPS which can be reversed. We give drugs such as anticholinergic drug, promethazine. So in the treatment, we give anticholinergic drug like promethazine. We can give benztropine. So such anticholinergic drugs are used. So basically there is a spasmodic or sustained involuntary contraction of a group of muscles in the face, neck, trunk, and even the larynx. So patient may come like this with torticollis, or there may be oculogyric crisis. The eyes are turned upwards. There may be laryngospasm. It is also important to remember that risperidone is a atypical antipsychotic, but again, it may also cause more D2 blockage. So it can also cause EPS and also has higher prevalence of amenorrhea because of hyperprolactinemia. So remember these two important side effects. One is EPS, which we have discussed, and also hyperprolactinemia, increase in the prolactin levels. These are occurring because of blockage of D2 receptors. Now, the typical antipsychotics, they are D2 antagonist, while when we talk about the second generation or the atypical, they are D2 and 5-HT2A antagonist. So remember, EPS and hyperprolactinemia, which is occurring because of D2 blockage, is more usually common with first generation than second generation. Risperidone is one of the second generation antipsychotic which may also have more of EPS and even hyperprolactinemia. And also remember, because of this hyperprolactinemia, sometimes a young female, she is on antipsychotic, may report of galactorrhea, that is milk secretion. She is not pregnant, she has not delivered any baby, but she is reporting of galactorrhea or cessation of menses. This is occurring because of hyperprolactinemia, which can occur because of antipsychotics. So remember, hyperprolactinemia can be seen with antipsychotics. Now let's talk about some important points about the defense mechanisms. Now when we are discussing the theories of Sigmund Freud, we discussed that defense mechanisms are basically the tools which the ego uses to balance out anxiety between id and superego. And most of these defense mechanisms kya hote hain? They are unconscious. So defense mechanisms are unconscious psychological operations that function to protect a person from anxiety, producing thoughts and feelings related to internal conflicts and outer stressors. So understand it like this: defense mechanisms are basically the tools which the mind is using to decrease some of the conflicts or stress. Now defense mechanisms are of various categories: mature, immature, neurotic, and also there is narcissistic. So also there is narcissistic defense mechanism. So these are the four categories you can remember like this: N, M, N, M. So N for narcissistic, immature, neurotic, and mature defense mechanisms. So these are the four categories in which the defense mechanisms are classified. Mature defense mechanisms are healthy and adaptive, as the name suggests, and they are seen in normal adults. These often help people in integrating the conflicting emotions and thought. For example, altruism. What is altruism? In altruism, the person is resolving his conflict by doing service to others. For example, somebody's spouse has died because of cancer. Now the partner is doing a no smoking campaign relentlessly, even if उसके लिए detrimental है, but अभी relentlessly वो campaign कर रहे हैं promoting no smoking for others. So this is doing gratifying service for others to deal with own emotions. Person may use humor. Sometimes the person may use humor to deal with own emotions. So these are some mature defense mechanisms. Then there are neurotic defense mechanisms. They may be encountered in various conditions. We'll discuss some of these examples, like in OCD or maybe in anxiety disorder, and also sometimes in adults under stress. Some of these defense mechanisms, neurotic defense, like displacement, intellectualization, and so many other defense mechanisms are there. Retroflexion is characterized by self-destruction due to rage. So retroflexion, it may lead to feelings of suicide, severe depression, and even deliberate self-harm. So this is retroflexion. Narcissistic defense, these are some of the primitive defense mechanisms, maybe seen in children, adolescent, maybe psychotic patients. Sometimes you'll see narcissistic defense mechanisms, and maybe also seen in severe personality disorders. These are most primitive defense mechanisms, जैसे कि denial, projection. So these are some important defense mechanisms. Let's discuss some of these defense mechanisms, their definition. So we'll discuss some of them mentioned in the master stroke. So one is sublimation. Remember, sublimation, it's a mature defense mechanism. As for sublimation, remember, the person is rechannelizing the impulse into socially acceptable behavior, into something constructive. So sublimation. For example, a child is scolded at home, so he is very angry from inside, पर वो क्रिकेट ग्राउंड में जाता है और अपनी टीम के लिए एक सेंचुरी बना देता है. So he has channelized the impulse into socially acceptable behavior. Next is projection. Now projection, remember, it's a narcissistic defense mechanism. नाम से ही पता चल रहा है कि अपनी inner feelings को, अपने unacceptable impulses को दूसरे पर प्रोजेक्ट करना. फॉर एग्जाम्पल, एक पर्सन का खुद का एक्स्ट्रा मैरिटल अफेयर चल रहा है, बट वो कन्विंस है कि मेरी वाइफ का एक्स्ट्रा मैरिटल अफेयर चल रहा है. ये है प्रोजेक्शन. डिनाइल, अगेन इट इज ऑल्सो, रिमेंबर, डिनाइल भी नार्सिसिस्टिक डिफेंस मैकेनिज्म है. यहाँ पे क्या करना है, डिनाई करना रियलिटी को, नॉट अलाउइंग रियलिटी टू पेनिट्रेट इन. सो रिफ्यूजिंग टू एक्नॉलेज द एग्जिस्टेंस ऑफ द रियल सिचुएशन. फॉर एग्जाम्पल, अ हस्बैंड इज डाइड and this news, sudden news of husband death wife को मिलती है, but wife, let us say, she is cooking and she continues to cook as if कुछ हुआ ही ना. तो इतनी ज्यादा डिस्ट्रेसफुल न्यूज थी कि माइंड में जब वो न्यूज आई तो माइंड ने कौन सा डिफेंस मैकेनिज्म यूज किया, डिनाइल का, कि उस न्यूज को, रियलिटी को पेनिट्रेट ही नहीं करने दिया अंदर, डिनाइंग ऑफ रियलिटी. ये है डिनाइल. देन नेक्स्ट इज रैशनलाइजेशन. रिमेंबर, रैशनलाइजेशन इज अ न्यूरोटिक डिफेंस मैकेनिज्म, कि अपने अनएक्सेप्टेबल बिहेवियर को रैशनलाइज करना, जस्टिफाई करना. सो रैशनलाइजेशन इज अटेम्प्टिंग टू मेक एक्सक्यूज और फॉर्मुलेट लॉजिकल रीजन टू जस्टिफाई अनएक्सेप्टेबल बिहेवियर या फीलिंग. फॉर एग्जाम्पल, somebody who is having alcohol use disorder, he says I consume alcohol because ये मेरी बॉडी के सारे जर्म्स को किल कर देता है. सो अपनी अनएक्सेप्टेबल बिहेवियर को रैशनलाइज करने की कोशिश करना. देन डिस्प्लेसमेंट, दिस इज ऑल्सो अ न्यूरोटिक डिफेंस मैकेनिज्म, कि अपना एंगर या इंपल्स को एक ऑब्जेक्ट से दूसरे ऑब्जेक्ट पर डिस्प्लेस करना. सो डिस्प्लेसमेंट इज ट्रांसफर ऑफ नेगेटिव इमोशन फ्रॉम वन पर्सन टू अनदर अनरिलेटेड पर्सन. फॉर एग्जाम्पल, कि हस्बैंड को बॉस ने ऑफिस में शाउट किया, स्कोल्ड किया, हस्बैंड को गुस्सा आया, ही कम्स होम, स्कोल्ड्स द वाइफ. वाइफ को गुस्सा आता है, स्कोल्ड्स द सन, और सन को गुस्सा आता है, गोज एंड पंचेस हिज फ्रेंड. तो कैन यू अप्रिशिएट कि यहाँ पे जो एंगर है वो कैसे ट्रांसफर हो रहा है फ्रॉम वन ऑब्जेक्ट टू अनदर. देन नेक्स्ट इज रिग्रेशन. Again, what is regression? To move back to earlier stage of development, पुरानी stage of development में regress कर जाना. तो ये है regression. And one is suppression. Now suppression is a mature, again it's a mature defense mechanism. अभी तक हमने डिस्कस किया कि सारे unconscious defenses हैं, but there is one exception. Remember, जो suppression है, it's a conscious defense mechanism. Consciously, knowingly person block करता है unpleasant memories को. So this is suppression. For example, you're studying and after a few days you feel कि now I'm tired, I'll take 1 day break. So consciously you decide or you postpone the studies. So this is known as suppression. Consciously person is blocking the unpleasant memories into the conscious mind, unconscious mind. So ये है suppression. So these are some definitions of some defense mechanisms which we have discussed. Now let us just discuss some of the defenses which are used in various conditions. So let's discuss in OCD some of the defenses which are seen is reaction formation is there, undoing is also one of the defense mechanism. Remember, even displacement, you can remember displacement is one of the defense mechanism which can be seen. Also remember, inhibition is also one of the defense mechanism which can be seen. And also remember, isolation of affect. So these are some defense mechanisms seen in OCD. In phobias, again you can remember displacement is one of the defense mechanism. Also remember repression. Repression is one of the defense mechanism which you can see in phobia. Repression. And also remember inhibition. Okay, so you can remember with this mnemonic dry. In phobias. In neurosis, important defense mechanism remember is repression. In grief, again remember we have just discussed one example also, denial can be seen in grief. In borderline personality disorder, a very important defense mechanism, remember, is splitting. So here basically the person, sees in extremities. Either everything is all black or all white. So person is seeing in extremities. This is splitting. So in borderline personality disorder, we know person may say that you are the best person I know. And on one occasion, person may say you're the worst person I know. So this is splitting, which can be seen in borderline personality disorder. Remember, one important therapy which we use in borderline personality disorder is dialectical behavior therapy. Schizophrenia, again in psychotic disorder, projection can be seen, even denial can be seen. Enuresis, sometimes let us say a 10-year-old child who had control over his bladder, and now his sibling is born, a brother or sister is born. So, again, the attention of the parent is now going towards the younger sibling. So he may regress to earlier stage of development. He may again start doing bedwetting. So remember, we have discussed, so regression, sometimes you'll see in such situation, regression may occur. So these are some defense mechanisms which we have discussed, right? Now let's talk about some points about mood disorder. And also remember, even substance use disorder, you can remember, there may be rationalization can be seen. Rationalization defense mechanism, and even denial can be seen. Even denial can be seen in substance use disorder. So sometimes patient with alcohol use disorder may say, no, sir, I don't drink. Maybe very occasionally, but family members giving you history, no, sir, 1 bottle alcohol every day. So denial may also be there. Now let's talk about some important points about mood disorders. Now in mood disorders, person may have depression, person may have bipolar disorder. These are two important categories of mood disorder. So in depression, the person is having episodes of depression. In bipolar disorder, as the name says, bipolar symptoms are present on both the poles. Sometimes patient has depression episode, sometimes there may be mania, hypomania. So kabhi khushi, kabhi gum. You can remember it like this, bipolar disorder. Now elevated mood, grandiosity, expansiveness, irritability, impulsivity, flight of ideas, pressured speech, impairment, judgment. These are some of the symptoms of mania. In fact, we have talked about the symptoms of mania with the mnemonic me dig fast. So remember this mnemonic, me dig fast, and we have discussed the symptoms for mania. And what is the duration for symptoms of mania? Remember, the duration is 7 days, that is 1 week. Now in many patients, so first symptom, it's mood disorder. Remember, first symptom always is of mood. So the mood may be very happy, sometimes the mood may be irritable. Now in many patients, when we talk about that the mood is elevated, you may see it in various stages. So let's discuss those 4 stages. First is euphoria. Now what is euphoria? Euphoria is when the mood is elevated with increased sense of well-being. So there is an increased sense of well-being, the person is very happy. Let's discuss the next stage, that is elation. Now in elation, what is happening? Along with euphoria, now the psychomotor activity is increased. Psyche means mind, motor means body. So psychomotor activity increase hogi along with elevation of mood. Third stage is exaltation. In exaltation now, along with elation, there is also grandiosity. So there is also delusion of grandiosity. And fourth is ecstasy. What is ecstasy? Now there is a sense of bliss. Aham brahmasmi. So such sense of bliss is seen in the patient. So these are the different type of stages of mood when the mood is elevated. Now also remember, in many patients, they are encouraged to perform activities such as exercise, as this act helps in the outlet of excessive energy in them. Now coming to the next mood disorder, that is depression. Depression is a mood disorder in which now the mood is sad. The person may report of persistent pervasive sadness of mood. And when we talk about the neurotransmitter, if they ask you 2 important neurotransmitters implicated in depression, these are serotonin, norepinephrine. Remember, both serotonin, norepinephrine, they are reduced in depression. Also, one more neurotransmitter you can remember, even dopamine, that is also reduced in depression. Now, as per ICD-11 and also DSM-5, the symptom should be present for how much duration? Yes, the symptom should be present for at least 2 weeks. Then we call it as depression. Now, what is the important hormone that plays a role in depression? Again, in fact, we have talked about neurotransmitter, and also remember one important endocrinal abnormality associated, such as hypothyroidism. Now, some of the symptoms of depression include persistent feeling of sadness, guilt, loss of appetite, suicidal thoughts, anhedonia, loss of interest. In fact, we have talked about the symptoms of depression with this mnemonic. Remember Sige caps. Remember Sige caps. Very important. Remember S for sad mood, I for interest is low, G for guilt or worthlessness, E is energy is low, C is concentration is low, A is appetite may be reduced, so there may be decreased weight, or it may increase, so there may be increased weight. P is psychomotor activity, may decrease, may increase. 1S is sleep disturbances, insomnia, hypersomnia, both can occur, and suicidal thoughts or acts may be there. One of the clinical signs for depression, sometimes you may see a patient having chronic depression may come with certain clinical signs. Usually we are making a diagnosis with symptom, but some signs may also be seen in depression. One is the omega sign. So remember omega sign, it's an omega shaped sign at the root of the nose on the forehead. You will see omega shaped sign, and sometimes you may also see a triangular fold at the medial side of the eye, that is known as Varigut's fold. So remember, even Varigut's fold may also be seen as a clinical sign in depression. Now persistent anhedonia is seen in clinical depression, remember, and sometimes in normal grief also person may appear sad, but sometimes the duration of symptoms, some of the other symptoms like persistent anhedonia and all those symptoms may help us differentiate between these two. Also there is a model or theory of depression, cognitive theory of depression, which was given by Aaron Beck. So Aaron Beck said that those patients who have depression, they have cognitive distortions. That means they have negative automatic thoughts. So normally when we sit, you will experience that automatically there will be some thoughts which will come in your mind, automatic thoughts. So in depression, he said that patients have negative automatic thoughts. These are also known as cognitive distortion. So patient may have automatic thoughts which are negative. So patient may say that without any reason I am having these negative thoughts in my mind. So this is the cognitive theory of depression. So cognitive errors are negative self-perception or maybe negative perception around the world and negative perception about the future. So he also gave a cognitive triad of depression. So there may be negative views of the self known as worthlessness, negative views about the environment, helplessness, and negative views about the future, no hope for the future, hopelessness. Introjection, remember, is one of the important defense mechanisms which is used in depression. So depression and myocardial infarction, they are risk factors of each other. So depression can increase the risk and MI can increase the risk of depression, and also major depression is one of the important psychiatric disorder associated with suicide. Also, let's talk about what is dysthymia. Dysthymia, you can remember, it's a milder form of depression. So here the person has milder symptoms of depression, but they are persistently present. Usually depression is an episodic illness, but in dysthymia the symptom may be persisting for a longer duration. So at least for how much duration the symptom should be present when we call it as dysthymia, remember it is 2 years. So remember it is 2 years. So this is dysthymia. And what is double depression? Also remember there is something known as double depression. So if dysthymia, so after dysthymia the person eventually develops a depressive episode, then we call it as double depression. Then we call it as double depression. Now drugs we have for management of depression, and also we have therapy. And the drugs, one of the important drugs or the drug of choice, remember, is SSRI. Then we have other drugs also such as SNRIs, TCAs. So SSRI, selective serotonin reuptake inhibitor. SNRI is serotonin norepinephrine reuptake inhibitor. TCA is tricyclic antidepressant, and NDRI is norepinephrine dopamine reuptake inhibitor. An important drug in NDRI, remember, one important drug is bupropion. But remember, drug of choice, if it is asked for depression, it is SSRI. So what does TCA stands for? TCA is tricyclic antidepressants, and that are used for management of depressive disorder. Remember, हम इन्हें antidepressant बोलते हैं, but ये anxiety disorder, other neurotic disorders में भी यूज करते हैं. कुछ examples TCA के हैं, जैसे कि amitriptyline, clomipramine, imipramine. Side effects of TCA, again, these side effects can occur because of anticholinergic property, जैसे कि ड्राई माउथ, ब्लड विजन, कॉन्स्टिपेशन. कुछ और साइड इफेक्ट जैसे फोटोसेंसिटिविटी, सिडेशन, सीजर्स, डिक्रीज लिबिडो, दीज कैन ऑल्सो अकर. अलॉन्ग विद ड्रग्स वी ऑल्सो यूज थेरेपी. और अगर पूछा जाए कौन सी थेरेपी ऑफ चॉइस है फॉर मैनेजमेंट ऑफ डिप्रेशन, रिमेंबर ये है CBT, कॉग्निटिव बिहेवियर थेरेपी. तो जिसमें हम पेशेंट की थिंकिंग यानी कॉग्निटिव थॉट्स को चेंज करते हैं. वी नो, हमने डिस्कस किया कॉग्निटिव थ्योरी ऑफ डिप्रेशन में कि पेशेंट को नेगेटिव ऑटोमेटिक थॉट्स आते हैं, तो वी आइडेंटिफाई दोज नेगेटिव थॉट्स, वी ट्राई टू करेक्ट देम एंड ऑल्सो वी चेंज द बिहेवियर. सो कॉग्निटिव बिहेवियर थेरेपी, जैसे कि हम एक्टिविटी शेड्यूलिंग यूज करते हैं, तो इसमें हम कॉग्निटिव टेक्निक्स को यूज करते हैं और बिहेवियर टेक्निक्स को यूज करते हैं. ECT यानी कि इलेक्ट्रो कन्वल्सिव थेरेपी भी हम यूज कर सकते हैं इन द मैनेजमेंट ऑफ डिप्रेशन लाइक इन सिवियर केसेस. ऑल्सो रिमेंबर ECT may be used, may be preferred in patients having suicidal thoughts. Patient is having suicidal thoughts in depression, ECT may be preferred. So remember, drug of choice for depression is SSRI. Therapy of choice for depression is CBT. अगर पूछा जाए कि ट्रीटमेंट ऑफ चॉइस क्या है डिप्रेशन के, तो रिमेंबर इट इज अ कॉम्बिनेशन, दैट इज ड्रग्स प्लस थेरेपी. बट अगर पूछा जाए इन दोनों में से एक चूज करने को, देन वी मे प्रेफर ड्रग्स ओवर थेरेपी. बट अगर पूछा जाए माइल्ड डिप्रेशन में, फॉर माइल्ड केसेस व्हाट यू विल यूज, देन अगेन यू कैन गो विद थेरेपी, दैट इज CBT. तो ECT भी हम यूज कर सकते हैं लाइक इन सिवियर केसेस, स्पेशली प्रेफर्ड इन पेशेंट्स विद सुसाइडल थॉट्स. ECT का मतलब क्या होता है? इलेक्ट्रो कन्वल्सिव थेरेपी. हम इलेक्ट्रिकल करंट पास करते हैं टू प्रोड्यूस कन्वर्जन, यानी सीजर्स प्रोड्यूस करने के लिए. ECT इलेक्ट्रो कन्वल्सिव थेरेपी, इट्स अ प्रोसीजर. Now we do it under general anesthesia and also we use muscle relaxant. So हम current pass करते हैं intentionally, we are producing seizures in the brain. It is divided into indirect या modified ECT and direct ECT. Direct ECT again remember, according to Mental Health Care Act 2017, India में अब direct ECT now is a prohibited procedure. We don't use direct ECT, we use modified ECT. Modified ECT का मतलब है along with anesthetic agent, we also give muscle relaxants to the patient before passing the electrical current. So we now use modified या indirect ECT. Succinylcholine is a muscle relaxant that has a rapid onset of action, and it is the most commonly used muscle relaxant used in modified ECT. It reduces muscle contractions to eliminate the chances of musculoskeletal injury and aid in airway management. So in direct ECT, usually one of the side effects would be that patient would have musculoskeletal injury, जैसे fractures हो सकते थे. So we are giving muscle relaxant to decrease the chances of these injury. प्री मेडिकेशन में जब हम ECT प्रोसीजर करते हैं, प्री मेडिकेशन में anticholinergic agents such as atropine can also be used to decrease the oral secretion to prevent aspiration due to the vagal stimulation. Around 90 to 150 volt for 0.3 to 2 seconds of current is passed to produce generalized tonic-clonic seizure. Remember, nowadays we use brief pulse waveform. In the modern ECT machine, we use brief pulse waveform. So remember, brief pulse waveform is used in the modern ECT machines. Side effects of ECT again include, when the common side effect is memory deficit may be there, and some of the other side effects like there may be headache, body ache may be there, delirium can occur, even injuries, although less chances now with modified ECT. So these are some side effects. The most common side effect usually is the memory deficit. So let's talk about the most common, the persistent side effect which is there is amnesia. Amnesia again, retrograde amnesia is more than anterograde amnesia, because of damage to the memory storage areas of the brain. Usually it is temporary, and it may also be commonly associated with advanced age, or if there is a pre-existing cognitive impairment, then the risk may be even increased. Is there any absolute contraindication for ECT? क्या ECT की कोई absolute contraindication है? Please remember, there is no absolute contraindication for ECT. हाँ, relative contraindications हैं, जैसे कि raised intracranial pressure, recent MI हुआ है किसी को, heart failure है, stroke है, aneurysm, hypertension, malformation, there is severe respiratory compromise may be there, retinal detachment. ये अब relative contraindication है. Please remember, कोई absolute contraindication नहीं है for ECT. Even in pregnancy, ECT can be given. So even pregnancy is not a contraindication for ECT. So let's talk about the next mood disorder, that is bipolar disorder. Now bipolar disorder, as the name suggests, कि patient को episodes हो रहे हैं depression के, mania के, hypomania के. Now bipolar disorder can be bipolar 1, bipolar 2. So when a patient has episode of depression and at least one episode of mania, उसे हम कहते हैं bipolar 1 disorder. So remember, bipolar 1 disorder में patient has at least one episode of depression and one episode of mania. If a patient has one episode of depression and at least one episode of hypomania, so then what it is known as? It is known as bipolar 2 disorder. So please remember, hypomania है ना, hypomania में the symptoms are similar to mania, but they're less severe. Mania का duration था 7 days at least. Remember, for hypomania the duration is at least 4 days. Now nowadays even a single episode of mania is also now considered as bipolar disorder. कौन सा? Bipolar 1 disorder. So we can say if a patient has at least one episode of mania, then we call it as bipolar 1 disorder. If patient has only episodes of depression and hypomania, that is called as bipolar 2 disorder. Now when we talk about the drug of choice for patients in bipolar disorder, now remember, patient in bipolar disorder may come to us with mania, hypomania, or may come to us with depressive episode. So in mania, remember, the drug of choice is antipsychotics. We can also use other drugs like lithium valproate, but remember, if you have asked to choose one, then you can choose antipsychotic. But all these three are first line drug in the management of mania in bipolar disorder. The normal value of serum lithium is 0.6 to 1.5 milliequivalent per liter. So we say lithium has a narrow therapeutic index or range. Symptoms of lithium toxicity occur when the lithium level is more than 1.5 milliequivalent per liter. The nursing advice for patient on lithium therapy is to drink adequate amount of water. It's very important because remember, if the patient has, let us say, dehydration, our body treats lithium like sodium. So remember this point. So for example, a person is dehydration. What will the body do? The body will reabsorb sodium, and it will also reabsorb lithium. So lithium toxicity can occur. Similarly, suppose patient को diarrhea है, patient has vomiting, again body will reabsorb sodium, body will reabsorb lithium. So again lithium levels can increase. So it's very important to maintain adequate amount of water hydration in the body. Now other examples of mood stabilizing agents. So we know lithium is a mood stabilizer. Also other mood stabilizer like carbamazepine, there is valproic acid, valproate. These are mood stabilizing agents. Now let's talk about the next and another important topic, that is substance dependence or substance use disorder. ICD-11 uses the term substance dependence. DSM-5 uses the term substance use disorder. Now substance dependence, as the name suggests, use of substance takes on much higher priority than other behaviors that once had greater value. So अब substance taking behavior की higher priority होगी life में, बाकी सब behaviors की value कम होगी, and that negatively affects the psychological, physiological and social functioning of an individual. Now let's talk about one very important substance, that is alcohol. Now alcohol, again remember, it's a CNS depressant. Alcohol is a CNS depressant. Now, toxicity can be presented with some of the important effects can occur as CNS depressant. Person may initially have agitation, person may have amnesia, even arrhythmias at a higher level in the body can have arrhythmia, and even respiratory depression can occur. Now sometimes person has amnesic episodes. There are alcoholic blackouts which occur during intoxication, and they're sometimes referred to as alcoholic palimpsest. So remember, so person may have these amnesic episodes during intoxication. Now let's talk about the alcohol withdrawal symptoms. So person is consuming, let us say, alcohol, and suddenly वो alcohol लेना बंद कर देता है. So these are withdrawal symptoms. Now you can appreciate, हमने कहा alcohol एक CNS depressant है. Person regularly एक CNS depressant ले रहा है, suddenly उसने लेना बंद कर दिया. So now can I say the brain will be in a hyper excited state. तो क्या withdrawal symptoms आ सकते हैं? The withdrawal symptoms may include tremors, hallucinations can occur, even seizures can occur. These are generalized tonic-clonic seizures, even delirium tremens can occur. Now please remember, the most common or the classic withdrawal symptom of alcohol is the tremors, usually which occurs 6 to 8 hours after the last alcohol intake. So suppose patient alcohol ले रहा था, 1 bottle of alcohol 750 ml every day, suddenly उसने alcohol लेना बंद कर दिया. So he may present with alcohol. Within 6 to 8 hours of stopping, he may present with tremors. Other withdrawal symptoms like increase in the blood pressure, sweating, these may also occur. Then if this withdrawal state continues, remember in the next 8 to 12 hours, he may develop alcoholic hallucinosis. So now the person may have hallucination like auditory hallucinations, maybe there even visual, even tactile hallucinations can occur. And if that withdrawal state continues, now let us say for the next 12 to 24 hours they continue, he may even develop alcohol withdrawal seizures, and he may also develop delirium tremens, up to 72 hours, may peak at 78 to 48 hours. For 72 hours it may even develop delirium tremens. So what is delirium tremens? So there is delirium. So along with the withdrawal symptom, now the person is in a state of delirium, that is impairment of consciousness may occur. Now remember some important points which are suggesting that there is impairment of consciousness Remember, if any of these points are mentioned in the question, this is suggesting कि impairment of consciousness है, यानी कि now the patient is having delirium tremens. So points they may mention, remember, the patient may have altered sensorium, or there is clouding of consciousness, there is disorientation to time, place, person, or they may mention confusion. So ACDC, remember it with this mnemonic: altered sensorium, there is clouding of consciousness, or there is disorientation, or there is confusion. Or any of these points are mentioned, this is telling us that अब impairment of consciousness शुरू हो गया, that means now the patient is in delirium tremens. For withdrawal seizures, again remember, treatment is benzodiazepine. For management of alcohol withdrawal, the drug of choice is benzodiazepines. If you are asked what is the drug of choice, it is benzodiazepine. Along with benzodiazepine, we can also give thiamine. But अगर एक पूछा जाए, then it is benzodiazepine. So we can use benzodiazepines for withdrawal seizures. We can use IV drugs like clorazepam, diazepam. So benzodiazepines, remember, are the drug of choice for treatment of alcohol withdrawal. Again, you can remember, पेशेंट एक CNS डिप्रेशन ले रहा था, सडनली उसने छोड़ दिया, तो ब्रेन इज इन अ एक्साइटेटेड स्टेट. सो नाउ टू मैनेज दो सिम्पटम, वी आर गिविंग अनदर डिप्रेशन, CNS depression, that is benzodiazepine. Physical dependence is the most common side effect due to prolonged use of benzodiazepine. So we know benzodiazepines can also cause, dependence. So that is why whenever we give benzodiazepines, we give it only for short term. So even physical dependence, even with benzodiazepine, can occur. Disulfiram is one of the therapies we used in the maintenance. So in the management of withdrawal symptom, we give benzodiazepines, along with this thiamine can be added. And then in the maintenance, one of the strategies is we give disulfiram. Disulfiram again has been used for quite some time, and it is a deterrent agent. Remember, it's a deterrent agent. What is the mechanism of disulfiram, if I ask? So what is the mechanism? Remember, it is aldehyde, ALDH, aldehyde dehydrogenase inhibitor. So remember, disulfiram, it's a aversive agent or a deterrent agent used in the management of alcohol. Disulfiram ethanol reaction. So when a person is taking disulfiram, and over it now if he consumes alcohol, he will develop some unpleasant symptoms, जिसे हम कहते हैं disulfiram ethanol reaction, which is characterized by symptoms like headache may be there, patient may have flushing, nausea, vomiting, tachycardia may occur, and sometimes if the levels increase very high, the person may even have cardiac arrhythmias, even respiratory depression. These may also occur. So disulfiram is one of the treatments or one of the drugs we use in maintenance. Also we use anti-craving agents. Remember, the anti-craving agents which we use in the management of alcohol, one is we have naltrexone, which is a opioid mu antagonist, and another is we have acamprosate. It is a NMDA antagonist. These are two FDA approved anti-craving agents for alcohol. Now in some patients who are consuming alcohol for a long time, they may also develop certain neurocognitive disorder. Two important neurocognitive disorder, remember, one is Wernicke's encephalopathy and another is Korsakoff syndrome. So these are neurocognitive disorders which occur because of deficiency of vitamin B1 or thiamine. So Wernicke's encephalopathy as well as Korsakoff syndrome, these are occurring because of thiamine, vitamin B1 deficiency. Now, what are the symptoms of Wernicke's? Remember the mnemonic GOA. There is global confusion, ophthalmoplegia and ataxia. Now in the treatment, what we'll give? Remember, deficiency of thiamine की वजह से हो रहा है, तो we will give thiamine, and usually it is reversible. Now if this thiamine deficiency remains untreated, gradually Wernicke's encephalopathy may lead to even Korsakoff syndrome. Remember, Korsakoff syndrome is a amnestic syndrome. यहाँ पे क्या important symptom है? Amnesia का, that is memory impairment. And also patient may have confabulation, which we have discussed, filling of memory gaps with false stories. So this is about some important points about alcohol. Also remember, in Korsakoff also the treatment is thiamine, but some symptoms may remain. So it is partially reversible, or you can say irreversible. Now next is cocaine. Cocaine is a stimulant. It's a stimulant, just like amphetamine is a stimulant. Cocaine is also a stimulant. It produces euphoria and alertness, and again it is also a substance use disorder category. It's a substance. Patient with cocaine intoxication may come to us. He is consuming cocaine, which is a stimulant. So kya important symptoms may occur? So intake of cocaine may show tachycardia, tachypnea. There may be seizures can occur. So in intoxication, remember, the body temperature needs to be stabilized. Also the renal cardiac functions need to be stabilized, as cocaine can cause arrhythmias, severe hypertension, even stroke can occur. Even remember, seizures can occur. And also remember, cocaine, it causes what? Meiosis or mydriasis? Remember, it causes mydriasis. So please remember, it causes mydriasis. Now, cannabis sativa is a herbaceous flowering plant. Again, it is sometimes used sometimes for medicinal and even for recreational use. So cannabis is derived from cannabis sativa. Some of the forms of cannabis include such as ganja. So ganja is a form of cannabis, again derived from flowering top of cannabis sativa and also consumed by smoking. Some other forms of cannabis include bhang. Then there is hash. Then there is also marijuana is there, charas is there. So these are various forms of cannabis, and they have different concentration of the psychoactive agent, that is delta 9 tetrahydrocannabinol, that is delta 9 THC. Cannabis use disorder again may be seen in around 10% of those who are using cannabis. So let's talk about what is cannabis induced psychotic disorder. So psychotic disorder means patient has delusions, hallucinations which may occur after cannabis use. So remember, cannabis induced psychotic disorder. So usually it is induced, so we don't have to give antipsychotics immediately after stopping cannabis. The symptoms may go. Yes, agar symptoms persist कर रहे हैं, then we also may have to give antipsychotic. One important phenomena जो हमें याद रखना है with cannabis is amotivational syndrome. Very important. So amotivational syndrome, as the name suggests, कि motivation कम हो रहा है. Chronic use of cannabis से there is decrease in motivation, decrease in the will to do task. So amotivational syndrome may be associated with cannabis. The next is opium. Is a milky white exudate from the plant. Which plant? Remember, Papaver somniferum, also known as poppy plant or opium poppy. Very important, remember the opioid intoxication. So triad of symptoms may be present. A patient who is come to us with opioid poisoning or opioid intoxication may have pinpoint pupil, very important, meiosis. In opioid intoxication, there is meiosis, while in cocaine intoxication, in amphetamine intoxication, even in TCA toxicity, there was mydriasis. So remember, pinpoint pupil or meiosis, respiratory depression, and even patient may come in unconscious or coma state. So this is important, triad of opioid intoxication. And what is the treatment? The drug of choice for opioid intoxication is naloxone. So IV naloxone, it's a opioid mu antagonist. It's a opioid mu antagonist. Remember, it's a short acting drug which is used in the management of opioid intoxication. Also remember, when we're talking about the management of opioid use disorder, patient may come to us in the withdrawal state or in the maintenance state. In the withdrawal state, again, we can give various drugs like methadone, like buprenorphine. Buprenorphine is what? It is a partial opioid agonist or a mixed opioid agonist antagonist. It is also used in the management of withdrawal. So we can manage the withdrawal with these drugs, and sometimes we can also do symptomatic management with drugs like clonidine to manage the withdrawal symptoms. Once the withdrawal symptoms are taken care in the maintenance, again we can use two strategies. एक strategy है opioid substitution therapy, जिसमें हम again methadone buprenorphine दे सकते हैं, and one more strategy is we can give naltrexone. Naltrexone क्या है? It's a opioid mu antagonist. So this is how we manage the withdrawal stage, and this is how we will manage the maintenance phase. Let's now discuss the organic disorders. Now organic disorders, remember, now in both DSM-5 and ICD-11, now they are known as neurocognitive disorders. So organic mental disorders को अब हम क्या बोलते हैं? Neurocognitive disorders. So one very important disorder in this category is delirium. So delirium is an organic brain disorder which has a acute onset. Suddenly the symptom will develop, and the characteristic feature is, remember, तो नाम से पता चल रहा है कि न्यूरोकॉग्निटिव डिसऑर्डर, कॉग्निटिव इम्पेयरमेंट है. रिमेंबर, इन डिलीरियम both the consciousness as well as the cognition, they are impaired. So consciousness is impaired. Remember, even in alcohol withdrawal delirium we discussed कि क्या important symptoms होंगे suggesting कि impairment of consciousness है. Remember the mnemonic ACDC, that is altered sensorium may be there, or they may mention clouding of consciousness, या फिर disorientation to time, place or person, or they may write confusion. So this is telling me consciousness impaired, and also there is impairment of cognition. So this is delirium. It is the most common organic mental disorder and may also lead to other symptoms like perceptual abnormalities can occur, such as hallucination. Which hallucination will be more common? Remember we discussed Visual hallucination usually are more common in organic disorders, and other abnormalities, maybe also there, like memory deficit. Some of the risk factors of delirium include old age. So old age you may see the risk of delirium is more. Infection, patient has infection like COVID or chest infection is there. There is head injury, even alcohol. We discussed even alcohol consumption, alcohol withdrawal can also lead to delirium. Now delirium can also have disturbances of perception, as we have discussed illusion, hallucination. We have discussed concept, visual hallucination may be more common. Other hallucinations can also occur. Some of the other symptoms can be there, like imaginary imagery may be there. Depersonalization, derealization. Depersonalization का मतलब है detachment from self. D मतलब detachment, personalization from self, or derealization, detachment from the real world around. So there may be depersonalization, derealization. Sundowning is a phenomena which may be seen with delirium. Sundowning का मतलब है as the sun goes down, the symptoms increase. So there is increase or worsening of symptoms in the evening या night time. You will see कि पेशेंट जिसको डिलीरियम है मॉर्निंग में, आफ्टरनून में सिम्टम में भी लेस, जैसे जैसे इवनिंग या नाइट आता है सिम्टम में इंक्रीज, इसे कहते हैं हम सनडाउनिंग. एंड ऑल्सो पेशेंट में हैव स्लीप डिस्टर्बेंसेस. नाउ व्हेनेवर अ पेशेंट विद डिलीरियम इज एडमिटेड इन द वार्ड, priority is very important. Orientation to time, place and person, and very important, even before this you can write down safety. One has to be, take safety measures because the patient is confused, there is impairment of consciousness, so patient may also get injury. So very important to maintain the safety of the patient. We tend to use orientation exercises for the patient, try to orient the patient to time, place, person. The most common drug which is used in management of delirium, remember, antipsychotic. If they ask you one name, then it is haloperidol. So antipsychotics may be used in the management of delirium. For example, patient has delusions, patient has hallucination, patient has agitation, so we may use antipsychotics. So remember, antipsychotic which is most commonly used is haloperidol, which is the first generation antipsychotic. So these are some points about delirium. The next is dementia. Again, dementia is also an organic mental disorder. It's a neurocognitive disorder. So dementia में क्या हो रहा है? Again, there is impairment of cognition, but please remember there is no impairment of consciousness. So delirium में consciousness और cognition दोनों impaired है, जबकि dementia में सिर्फ cognitive impairment है. Dementia में which important neurotransmitter is reduced? Remember, it is acetylcholine. So there is decrease of acetylcholine in dementia. Some of the risk factors for dementia include old age, then family history, even low education, female sex. And the most common cause of dementia overall is Alzheimer's disease. So remember, it is Alzheimer's disease. Second most common cause, if I ask you, it is Lewy body disease. So remember, Lewy body disease is the second most common. Third, you can say, is vascular dementia. The priority nursing intervention for elderly patient include measures for fall prevention. Again, person may injure themselves, so one has to maintain safety, as they may have slower reflexes, decreased ability to adapt to the new environment, and balance issue may be there. So very important to have safety precautions. Dementia again can be divided into, based on the lesion, cortical, subcortical and mixed type of dementia. Cortical dementia, in which the cortex is initially involved, later on even the subcortex may be involved. So some of the examples include Alzheimer's disease, pig disease, also known as frontotemporal dementia. So if you know another name, frontotemporal dementia, the name is telling us कि इसमें frontal और temporal lobe involved है. So pig disease also is a cortical dementia, and also Creutzfeldt-Jakob disease, these are included in cortical. In the subcortical dementia, see this, some of these examples which we read in medicine: Parkinson disease, multiple sclerosis, Wilson's disease, even HIV associated dementia, PSP, all these, these are subcortical dementia. And usually we talk about motor abnormalities here. So can I say in subcortical dementia, usually the patient may present with motor abnormalities, and then gradually the patient may also develop cognitive impairment. In mixed type, that is both the cortex and the subcortex may be involved, include vascular dementia and even Lewy body disease. These are included here. Now let's talk about some points about eating disorder. So in eating disorder, usually, we have anorexia nervosa, bulimia nervosa, binge eating disorder. These are some of the eating disorders included, and all these are more common in female. Anorexia nervosa, bulimia nervosa. So again, these are more common in female. And anorexia nervosa, the most common age of onset is around 14 to 18 years. Bulimia nervosa also, the onset may be late adolescent, young adulthood. Both of these disorders are characterized by intense fear of gaining weight, but a very important difference. Anorexia में क्या हो रहा है? The patient avoids, or there is restriction of energy intake, which leads to decrease in the weight. Very important is in anorexia nervosa, the weight or the BMI is reduced. प्लीज रिमेंबर एनोरेक्सिया नर्वोसा में भी दो सब टाइप्स होते हैं. एक होता है रिस्ट्रिक्टिव टाइप, जिस द मोस्ट कॉमन पेशेंट इज रिस्ट्रिक्टिंग एनर्जी इनटेक. इवन बिंज ईटिंग पर्जिंग टाइप इज ऑल्सो सीन इन एनोरेक्सिया नर्वोसा. तो बिंज ईटिंग का मतलब है ईटिंग लार्ज अमाउंट ऑफ फूड इन लेस टाइम, एंड देन पर्जिंग मतलब यूजिंग कंपनसेटरी बिहेवियर, जैसे कि सेल्फ इंड्यूस्ड वॉमिटिंग. ये भी एनोरेक्सिया नर्वोसा में मिल सकता है, जो कि हमें बुलिमिया नर्वोसा में भी मिलता है. सो बुलिमिया नर्वोसा में भी वी नो दैट पेशेंट हैज बिंज ईटिंग फॉलोड बाय पर्जिंग. But difference क्या है? In bulimia nervosa you will see that the weight or the BMI will be normal or maybe increased. जबकि anorexia nervosa में because of restriction of energy intake there is decrease in weight and BMI or BMI. Patient with anorexia nervosa, patient may have bradycardia, may have hypotension, may have hypothermia. Again, because of starvation, patient is in a state of starvation, so patient may have these complications in anorexia nervosa. Now let's talk about some important points in child psychiatry psychology. According to the American Association of Mental Retardation, now intellectual disability is the new term. So now intellectual disability is a new term we use in DSM-5 for mental retardation. Now normal IQ level is 90 to 109 and it is calculated. What is the formula to calculate IQ? IQ क्या है? Intelligence quotient, mental age upon chronological age into 100. क्रोनोलॉजिकल एज मतलब जो हम डेट ऑफ बर्थ से कैलकुलेट करते हैं. मेंटल एज वी कैलकुलेट बाय परफॉर्मिंग सम टेस्ट एंड वी कैलकुलेट IQ. Now based on the IQ we can divide mental retardation into 4 categories, 4 levels of severity: mild mental retardation, moderate, severe, and then there is profound. What is mild mental retardation? Now remember, mental retardation we say when the IQ is less than 70. So mild mental retardation is when it is 50 to 69. Moderate is when it is 35 to 49. What is severe? Severe is when it is 20 to 34, and profound कब है? When it is less than 20. Very important, remember these values. So these are some important points about IQ. Let's now discuss another important disorder in child psychiatry, that is autism spectrum disorder. Now autism spectrum disorder, remember it is now considered as a neurodevelopmental disorder. It's a neurodevelopmental disorder and there are two important features of autism spectrum disorder. So what they've done कि पहले जो अलग अलग disorders थे उनको अब हमने एक कैटेगरी में रख दिया, autism spectrum disorder. जैसे कि autism, Rett syndrome, Heller syndrome, Asperger's disorder, ये सब disorders को अब हम क्या कहते हैं? autism spectrum disorder. इसमें दो important कोर फीचर्स हैं. पहला है डेफिसिट इन सोशल कम्युनिकेशन, बच्चे की सोशल कम्युनिकेशन इंपेयर्ड है. और दूसरा है द चाइल्ड हैज रिस्ट्रिक्टेड रेपिटेटिव पैटर्न्स ऑफ बिहेवियर्स, इंटरेस्ट, एक्टिविटीज. सिमिलर बिहेवियर, सिमिलर एक्टिविटीज बच्चा बार बार कर रहा है. तो देयर आर टू कोर फीचर्स. एक है प्रॉब्लम्स इन सोशल कम्युनिकेशन एंड देयर इज रिस्ट्रिक्टेड रेपिटेटिव पैटर्न्स ऑफ बिहेवियर in the child. So this is autism spectrum disorder. Usually we know autism spectrum disorder are more common in males than females. One important exception is Rett syndrome. Remember, Rett syndrome is more common in females than males. Now what is PANDAS? PANDAS, it stands for pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. So PANDAS है, ये पेडियाट्रिक एज ग्रुप में होता है. इसका ओरिजिन यूजुअली सेड इट इज ऑटोइम्यून इन नेचर. न्यूरोसाइकाइट्रिक डिसऑर्डर्स डेवलप होते हैं बच्चे में, जैसे ओसीडी, टिक्स कैन अकर विच आर एसोसिएटेड विद स्ट्रेप्टोकोकल इन्फेक्शन. सो समटाइम व्हाट हैपेंस कि बच्चे को इन अ चाइल्ड ओसीडी सिम्टम, टिक सिम्टम्स आर प्रेजेंट सडनली, and when you take a history there may be history of some infection like sore throat may be there, scarlet fever may be there. So it is seen that streptococcal infection is also sometimes associated with OCD tics, और इसे हमने term किया PANDAS. Now let's talk about some neurotic stress related and somatoform disorders. Now remember हमने discuss किया organic disorders, हमने discuss किया psychotic disorder like schizophrenia. Mood disorders हम बोलते हैं somewhere in between, कि depression थोड़ा neurosis की तरफ है and bipolar disorder is towards psychosis. Let's now discuss some important points about these neurotic disorder. Now what is resilience? It is a process of adapting well in the face of adversity, trauma, tragedy, threats, or significant source of stress. So this is known as resilience, the process of adapting well. Some people, due to this mental ability, overcome a stressful condition, whereas some, they may end up in crisis. Some examples of neurotic disorders include anxiety disorders, including phobias. So there are five, at least five anxiety disorder you can remember. Panic disorder, 3 phobias, कौन से हैं? agoraphobia, specific phobia, and social phobia, and one is generalized anxiety disorder. Another important category is obsessive compulsive and related disorder, जिसमें OCD आता है और different disorders आते हैं. Then there is trauma and stress related disorder, जिसमें PTSD आता है, adjustment disorder आता है, acute stress disorder आता है. Then you have another category, somatoform disorders, dissociative disorders, conversion disorder, these disorders. So let's discuss few points. Selective mutism, remember, is also a form of anxiety disorder, usually seen in childhood, and again it can occur even in adulthood. So selective mutism, जैसा नाम से पता चल रहा है, the person who is normally capable of speech, they cannot speak in specific situation or to a certain specific people. इसे कहते हैं selective mutism. Now somatoform disorders, these are a group of psychological disorders. नाम से पता चल रहा है, somato means bodily symptoms. So patient experience some physical symptoms. So patient में report of pain in the abdomen, patient कह रहे सर मुझे headache है, but हमने investigate किया, examine किया, सब कुछ normal है. मतलब symptoms body produce नहीं कर रहा, symptoms are produced by the mind. So they are inconsistent with or cannot be fully explained by the general medical condition. Dissociative disorders की वहीं हम बात करें, they are condition in which there is disruption or breakdown in the memory, awareness, identity or perception. So there is dissociation or integration of one function from the other functions. So या तो memory, awareness, identity, perception, one of these functions may get dissociated with other function. Dissociative disorders और conversion disorder को previously hysteria कहा जाता था. Conversion disorder में क्या होता है? Conversion disorder DSM-5 में हम बोलते हैं functional neurological symptom disorder. यहाँ पे पेशेंट को न्यूरोलॉजिकल सिम्टम्स आ रहे हैं विच आर फंक्शनल नेचर. फॉर एग्जांपल पेशेंट कह रहे हैं कि आई एम नॉट एबल टू सी, सेंसरी सिम्टम है, या फिर पेशेंट को एबनॉर्मल जर्की मूवमेंट, सीजर जैसी मूवमेंट आ रही है बट एक्चुअली ट्रू सीजर नहीं है, स्यूडो सीजर. इसे कहते हैं कन्वर्जन डिसऑर्डर. नाउ वेरी इंपॉर्टेंट टर्म यू शुड रिमेंबर इज ला बेला इंडिफरेंस. इंडिफरेंस का मतलब होता है कि इंडिफरेंट टू, यानी फर्क नहीं पड़ना. ला बेला इंडिफरेंस कैन बी सीन इन डिसऑर्डर लाइक कन्वर्जन डिसऑर्डर. Lack of concern shown by the patient towards their serious symptoms. So it can be seen in condition like conversion disorder. जैसे suppose एक conversion disorder का patient जिसको neurological symptoms हैं, like he's not able to see. Now if we are not able to see, we may be in a state of panic. But this patient is sitting comfortably and seems to be unbothered by this serious symptom. इसे कहते हैं la bella indifference. Now next, let's talk about PTSD, post-traumatic stress disorder. Again, is a type of trauma and stress related disorder usually which occur after a severe trauma. तो हिस्ट्री में सिवियर ट्रॉमा की हिस्ट्री होगी, जैसे कि मे बी सीरियस एक्सीडेंट है, किसी ने कोई वॉर एक्सपीरियंस किया, कोई किडनैप हुआ, देयर इज अ हिस्ट्री ऑफ अब्यूज, सो देयर मे बी अ सीरियस ट्रॉमा. उसके बाद पेशेंट में डेवलप सम सिम्टम्स एंड वी हैव डिस्कस द सिम्टम विद द निमोनिक माही. एम से मूड एंड कॉग्निटिव सिम्टम, नेगेटिव मूड स्टेट हो जाएगी या नेगेटिव थॉट हो जाएंगे. वेरी इंपॉर्टेंट ए इज अवॉइडेंस. पेशेंट उस ट्रॉमा से रिलेटेड चीज़ों को अवॉइड करेगा. फॉर एग्जाम्पल उसका अगर एक्सीडेंट हुआ तो उस कार को अवॉइड करेगा, उन लोगों को अवॉइड करेगा जो उसके साथ उस टाइम पे एक्सीडेंट में थे. तो वेरी इंपॉर्टेंट, रिमेंबर ए. देन देयर मे बी हाइपर अराउजल सिम्टम, जैसे पेशेंट अब हाइपर अराउजल स्टेट में बड़ा जल्दी घबरा जाएगा. देयर इज डिक्रीज कॉन्सेंट्रेशन, डिक्रीज स्लीप. अनदर इंपॉर्टेंट सिम्टम इज आई. आई का मतलब है इंट्रूजन सिम्टम. अब उस सिम्टम्स को, उस ट्रॉमा को बार बार री एक्सपीरियंस करेगा इन द फॉर्म ऑफ फ्लैशबैक. पेशेंट कहेगा उस ट्रॉमा की फ्लैशबैक्स आते हैं या मुझे डिस्ट्रेसिंग ड्रीम्स आते हैं अबाउट दैट ट्रॉमा. So Mahi wali symptom, remember this mnemonic, after a serious trauma and if the symptoms are present for 1 month or more तो हम उसे कहते हैं PTSD. वहीं अगर ड्यूरेशन लेस देन 1 month है तो उसको हम कहेंगे acute stress disorder. The diagnosis of PTSD, the patient must have persistent remembering or reliving of the symptom, intrusive symptom जैसे flashbacks हैं, vivid memories हैं. So again remember avoidance and intrusion symptom very important, especially जब हम MCQs में diagnosis बना रहे हैं for PTSD. Nursing intervention in patient with PTSD include, again calming, reorienting them to the current situation. Now coming to phobias, phobias a type of anxiety disorder. नाम से पता चल रहा है, now the person is having, fear of certain situation. Now, phobias can be agoraphobia, can be specific phobia, and can be social phobia. So these are the three important phobias. Now there are different types of phobias. What is claustrophobia? Claustrophobia is a type of specific phobia जिसमें there is fear of closed places. What is acrophobia? Acrobats do stunt on height. तो acrophobia क्या हो गया? Fear of heights. Pyrophobia, fear of fire, and algophobia is fear of pain. Again, there are so many named phobias. Now, what is OCD? In obsessive compulsive and related disorder, one of the important disorder is OCD. OCD का मतलब है ऑब्सेसिव कंपल्सिव डिसऑर्डर. यहाँ पे पेशेंट को ऑब्सेशंस हैं. ऑब्सेशंस का मतलब रेपिटेटिव थॉट्स हैं या बिहेवियर हैं, या फिर रिपीटेटिव ऑब्सेशन का मतलब रेपिटेटिव थॉट्स हैं, इमेजेस हैं या इंपल्सेस हैं. हम जब भी ऑब्सेशन डिस्कस करते हैं वी यूज दिस निमोनिक ना रोजी, यानी कि ये जो ऑब्सेशन है रेपिटेटिव हैं, उन पेशेंट को पता है मेरे अपने थॉट्स हैं बट उसको पता है सेंसलेस है. वेरी इंपॉर्टेंट. पेशेंट ट्राइज टू रेजिस्ट देम बट दे आर इररेजिस्टिबल. तो ऑब्सेशंस आर रेपिटेटिव थॉट्स. And then patient may also have compulsions. The person may be doing certain acts again and again to decrease the anxiety related by the obsession, and sometimes compulsion may occur even without obsession. So patient को obsessions and compulsions हो रही हैं. This is OCD. In the management of OCD, we have again drugs, we have therapy. In the therapy, we use CBT, and one of the important therapies, remember, is ERP, exposure and response prevention therapy. Very important, which is used in the management. So if you're asked therapy of choice, this is one of the therapies which is preferred. And medication में we have drugs. One is we have SSRIs, and there is one important TCA, that is, so SSRIs, and there is one important TCA, that is clomipramine. These are the first line agent. But if you're asked what is the drug of choice, again the drug of choice is SSRI. And treatment of choice, अगर आपसे पूछा जाए drug of choice SSRI, therapy of choice you can say CBT, like ERP is the preferred therapy. And if you're asked the treatment of choice, remember it will be combination, that is drugs plus therapy. So please remember these points. Now coming to some terms, trichotillomania. Remember tricho means hair, so this is repetitively pulling out one's own hair. In fact, this is now included in obsessive compulsive and related disorders की category, जिसमें हम OCD को भी place करते हैं. Pyromania means pyre means fire, so there is repetitive fire setting. Kleptomania means repetitive stealing. Again, these are impulse control disorders. Rhinotelexomania means habitual nose picking. So these are some terms which you can remember. Now let's talk about the personality disorders. Now in personality disorders, first let's talk about what is personality. One important theory in personality is the big 5-factor theory, which broadly divides the personality into 5 traits. So you can remember it with the mnemonic oceans. So what is this? Ocean, O is openness, so how much the person is open to new idea, is curious, creative or original. C is conscientiousness, being organized, systematic, ambitious, punctual, dependent. E is extraversion, is the person outgoing, talkative, social. A is agreeableness, being tolerant, sensitive, kind. N is neuroticism, that is either being anxious, irritable, or moody. So these are the 5 broad personality traits in this theory, the big 5-factor theory of personality. Now coming to personality disorders. Now we know that personality, normally all of us have a personality which develops by 18 years. So this is how personality would develop and it will remain stable through time. अगर किसी को पर्सनालिटी डिसऑर्डर हो गया, यू विल सी पर्सनालिटी डिसऑर्डर का भी ऑनसेट आपको दिखेगा यूजुअली लेट एडोलेसेंट या फिर अर्ली एडल्टहुड में, एंड द सिम्टम्स विल रिमेन स्टेबल थ्रू टाइम. तो पर्सनालिटी डिसऑर्डर्स को हमने 3 मेन क्लस्टर्स में डिवाइड किया है. कौन कौन से क्लस्टर्स हैं? रिमेंबर, क्लस्टर ए, बी एंड सी. क्लस्टर ए में 3 पर्सनालिटी डिसऑर्डर्स आते हैं. Which all disorders? Schizoid personality disorder, paranoid and schizotypal personality disorder. Remember यहाँ पे जो characteristic है, group characteristic, यहाँ पे the person may appear very odd, the person may appear very eccentric. So one W you can remember, that is the person may appear weird. Cluster B personality disorder में there are 4 personality disorders. कौन कौन से? We have antisocial personality disorder, borderline personality disorder, histrionic and narcissistic personality disorder. 1W you can remember here, wild. The person may appear very erratic. The person may appear very dramatic here. Cluster C में we have 3 personality disorder, dependent personality disorder, anxious avoidant personality disorder, obsessive compulsive personality disorder. Here the person may appear anxious. You can remember 1W, worried. So these are the three clusters of personality disorder. Obsessive compulsive personality disorder is also known as anancastic personality disorder. In ICD-10 it was known as anancastic also personality disorder. So please remember, here the name is obsessive compulsive, but यहाँ पे कोई obsessions, there is no obsessions, there is no compulsion, क्योंकि obsession compulsions अगर होंगे तो उसे हम OCD कहेंगे, not OCPD. So OCPD में there are no obsessions or compulsion. Here the person is preoccupied with rules, regulation. Person को हर चीज perfectly करना है, imperfection. So person may be very rigid, very stubborn. So OCPD. Now according to the APA, depersonalization is one of the common symptoms you will see comorbid with depression, anxiety, personality disorders. Now let's talk about some important tables. Now coming to this table of neurotransmitters. In schizophrenia, remember, again in the neurotransmitters we have discussed, in our lectures previously. So dopamine is one important neurotransmitter implicated. तो डोपामिन इनिशियली एक हाइपोथेसिस आया था, डोपामिन हाइपोथेसिस का, विच स्टेटेड कि डोपामिन इंक्रीज हो जाता है, बट अब हमें पता है कि इन वन पाथवे, मेसोलिम्बिक पाथवे में डोपामिन इंक्रीज होता है, इन मेसोकॉर्टिकल पाथवे डोपामिन डिक्रीज. सो रिमेंबर डोपामिन इज देयर, इवन सेरोटोनिन इज इंक्रीज्ड. एंड हाउ टू रिमेंबर दिस, हाउ टू कोरिलेट दिस विद द मैकेनिज्म ऑफ एक्शन ऑफ ड्रग्स. हमने डिस्कस किया फर्स्ट जनरेशन है ड्रग्स और सेकेंड जनरेशन है. फर्स्ट जनरेशन में वी आर यूजिंग डोपामिन एंटागोनिस्ट, तो वी आर सेइंग कि डोपामिन इंक्रीज हो रहा है तो हमने डोपामिन एंटागोनिस्ट दिया. सेकेंड जनरेशन इज नॉट जस्ट डोपामिन एंटागोनिस्ट, सो नॉट जस्ट D2 ब्लॉकर बट ऑल्सो 5-HT2A एंटागोनिस्ट. सो कैन यू अप्रिशिएट, वी आर सेइंग कि सेरोटोनिन भी इंक्रीज हो रहा है, सो वी आर यूजिंग सेरोटोनिन एंटागोनिस्ट. सो दिस इज हाउ यू कैन ऑलवेज कोरिलेट 5-HT2. Then even other neurotransmitters like GABA, norepinephrine, glutamate, acetylcholine, nicotine, these are also implicated. Many of them are reduced in schizophrenia. So depression may we have discussed, if you are asked two important neurotransmitters, remember serotonin and norepinephrine, they are reduced. Even dopamine is also reduced. In mania, remember dopamine is increased. So one of the drugs we remember, that is antipsychotics, are used in the management, and also other neurotransmitters are also implicated. In OCD, remember again serotonin dysfunction is seen. Alzheimer's may very important, remember acetylcholine is reduced, and also one important neurotransmitter, that is glutamate, may also be increased initially and gradually may decrease. So for Alzheimer, remember acetylcholine, even homocysteine, that may also be affected. Remember acetylcholine is reduced, and from this you can correlate the mechanism of action of drugs we use for dementia. So we are saying that acetylcholine is reduced, so we are using cholinesterase inhibitors which are increasing the acetylcholine in the body. So drugs like donepezil, drugs like rivastigmine, galantamine, these are the drugs that are cholinesterase inhibitor. We are saying that glutamate is increased, so we are using glutamate receptor antagonist, NMDA antagonist, कौन सा drug? Memantine. So remember it like this so that you don't forget. Now also let's talk about the symptoms of schizophrenia. So we know positive symptoms हैं like delusions, hallucination, even other behavior symptoms can be there. Disorganized thoughts sometimes also considered as disorganized symptoms. Then there may be aggression, hostility. So positive symptom. Negative symptom may remember we have talked about, there is anhedonia, avolition, remember asociality, then there is asociality is there, then even affective flattening we have discussed. Affective flattening can be seen. Alogia can also occur, and even other symptoms like attention deficit, apathy, these may be seen. So these are negative symptoms. Now what is the diagnostic criteria of schizophrenia? We have discussed, to make a diagnosis the symptoms should be present for at least 6 months. Suppose if the symptoms are similar to schizophrenia but the duration is less, then we call it as acute psychosis. In DSM-5, acute psychosis is further divided into two. So if the symptoms are less than 1 month, then it is known as brief psychotic disorder. But if the symptoms are more than 1 month but less than 6 months, then that is known as schizophreniform disorder. Schizophreniform disorder. Similarly, ICD-11 uses the duration of 1 month for schizophrenia. So anything less than 1 month, it is known as acute and transient psychotic disorder, ATP, or it's a form of acute psychosis, remember. Now if we talk about the drug of choice for OCD, remember the drug of choice will be SSRI, for example, like fluoxetine, sertraline. For mania, remember for acute mania, it will be antipsychotic. For maintenance, you can choose lithium. For depression, please remember, for depression, it will be SSRI. SSRI is the drug of choice for depression. So for depression, we use SSRIs as the drug of choice. So these were some important points we have discussed from the master stroke, and try to discuss these points, try to understand these points. And I hope this was useful, and continue persisting with your efforts. Keep revising your notes. Also keep doing MCQs, very important. So revision MCQs are very important, especially during this phase of your exam. So again, I always say this at the end, keep a smile every day, keep smiling and keep moving forward. Take one day at a time and you'll see everything will be all right. So with this, we will conclude this session. Thank you so much. May God bless you all.